Ma'am, shall I?
Ma'am, please start.
Good evening to one and all present here. On behalf of School of Arts and Science, Nagamishan University, deemed to be university, I welcome all the participants from different institutions for the fourth day Atal Faculty Development Program on the future of healthcare, AI-infused medtech innovations. The first session is on AI in public health and epidemiology by Dr. K.S. Kuppuswamy, Associate Professor, Department of Computer Science, Pondicherry University. I welcome our distinguished speaker for this session. Before going to session, I invite Dr. C. Ambikavati, Associate Professor, Department of Computer Science, School of Arts and Science, to introduce our distinguished speaker. Ambika, ma'am.
Yes, ma'am. Good evening to one and all present here. I am very much privileged to introduce today's speaker of Atal FTP, Dr. K.S. Kuppuswamy, Associate Professor of Computer Science Department at Pondicherry Central University. Dr. Kuppuswamy has completed his UG and PG in Madurai Kamaraj University and he has completed his PhD in Pondicherry University. He has more than 20 years of teaching and research experience in both academy and industry. He has also received Best Teacher Award 6 times. His area of interest includes accessibility computing, human-computer interface, information security, machine learning, etc. And he is more interested in to innovate the technological solution for the problems faced by persons with disabilities. He has published a number of papers, also received an IBM Certificate of Appreciation for Mentor in Great Mind Challenge. He is an university rank holder in both his UG as well as PG. He has launched a mobile application to assist persons with visual impairments for better navigation. He has also guided 6 PhD scholars in their research. His publications includes more reputed journals such as ACM and other international journals. I am very happy to welcome you, sir, for this Enlighter session.
Thank you, ma'am. Now I request Dr. K.S. Kuppuswamy, sir, to take over the session.
Okay. Am I audible?
Yes, sir, you are audible.
Yes, sir.
Yes, sir. Yes, sir.
Okay. So to start with, I would like to thank the Vinayaka Missions University and the people who are handling this particular course. And so it's an evening time and you have all joined online. I hope you are all in various different places committed with different activities. Anyway, we are going to spend 90 minutes time here. So I want you to get some take-home points when you complete this session. So let's make it a meaningful one because you are putting your time and I'm putting my time. So therefore, there should be some take-home points when we leave out of this session. So let me share my screen. Just a minute. Just a moment.
Your screen is visible, sir.
Yeah, are you able to see my screen?
Yes.
Okay. I hope you are able to see my slides, isn't it?
Yes, we are able to see.
Okay, right. So this session is on AI in public health. As you all are aware, today we are all talking about the AI in various different disciplines. So before I go into the public health related things, so let me take few minutes time in setting the context on what AI is actually doing. If you see the human history, it happens so rarely that we have something called a general purpose invention. For example, if you take electricity, electricity is a general purpose invention. We can divide the human history into two types, like before the invention of the electricity and after the invention of electricity. Electricity changed everything that we do, like how do we transport, how do we cook, how do we broadcast information, how do we create heat, how do we create light, how do we create the sound. Everything got modified by the electricity. Because electricity, we call it as a general purpose innovation. Similarly, now we have AI. AI is also a general purpose innovation. The quality of a general purpose innovation is that it will have impacts on almost all spheres of life that we are having. It doesn't matter that whether you are working as a teacher or you are a doctor, you are a lawyer, or you are in any field. AI's impact will be there because AI has the potential to go into the fields of every different domains. Now you can see, you might have seen that right from the school-going children in our home to the researchers that we are talking about, everyone is using AI. And it will be having impacts, right? It is not going to be simply like we are going to have a meager impact on this thing. And AI is going to have a huge impact on so many different disciplines. Okay, let's go into this. This is my session's agenda. So let's go into the public health thing now. Let me put my position very clearly. I'm not a public health expert. I'm doing research in AI, and my research team, we collaborate with the JIPMER. We work with the dermatology department and the cardiology department to apply the AI-related stuffs into various different things that they do. We have developed classification models. We have developed some sort of a recommender systems for both the dermatology department and cardiology department. Under that umbrella, I will be giving you this particular talk. So, what is public health? Public health is like the science and practice of protecting and improving the health of the population. Here, when we talk about the medicine, we talk about the individual of one person. But here, it is the health of the population. Many times, the health of the population is what determines the health of an individual. When the population is affected, we will be having, the individual cannot be healthy. For example, we all faced this tremendous problem of COVID-19. When the pandemic was going on, it is like it became a global problem, and individual, however strong he may be, he cannot protect himself because the entire surroundings are affected. So therefore, governments across the world are very much interested in creating public health the strong public health systems. So the key characteristics of public health is that it will be focusing more on the prevention rather than treatment. If you go to the medical domain, where they talk more about after the onset of a disease, how are we going to prevent that? But in public health, here we talk about more on the prevention, like before the onset of a malaria, how do we prevent? Similarly, before the onset of a dengue, like now you see we are in a rainy season here, and many places people are reporting the dengue cases. In our department, we also have a project on the malaria related and dengue related awareness creation stuff kind of a thing, where people are working in which area the mosquito populations are higher. They work in collaboration with the health department, so that this can be created like the analytics will be provided easily, so that they can work on that particular thing in a very effective way. So the public health operates at the community level or at the population level. Suppose if you take Pondicherry or Tamil Nadu, for example, you may be having different levels of governments, and where if you take the local government, they will be working at a city level, or someone may be working at a district level. So they take the population at that particular level. If you take the Ministry of Health, they will be like taking over the entire population of the country, and they will be working on the overall health of the country. So here the major concern is how are we going to address the social, environmental and behavioral determinants of the health. That's all these three components are very, very important. Like there are some components which are determined socially, and environmental factors are also there. Like for example, if you take air pollution, the air pollution may induce various different kinds of diseases, and there are people who are very allergic to such kind of things. They are like more susceptible to fall into kind of problematic things. So therefore, which is the vulnerable population, how to protect them? In all these things, they focus. For example, the vaccination campaigns, clean water and sanitation systems, and tobacco control policies. All these things are examples of public health. See here, if you see all these things are related to data. Whether, say for example, again take the COVID-19 example, where many countries were of the opinion that India will become a major problem because they will not be able to provide vaccination to 100 plus crore citizens. It is going to become a big mess. But our government handled it so effectively that we had a platform called CoWIN, through which we effectively trace the movement of the vaccines and the targeted delivery of the vaccine systems. And it so happened that even the smaller countries elsewhere were struggling to provide vaccination to their population. But we, as a large nation, we successfully handled the COVID-19 thing. There, a prominent role of AI also is there, where the technological impacts, like the CoWIN platform, what they built, I guess it was built by the IIT Madras team. So there they created this platform, and therefore it was so easy. And even this now government is very much on this tuberculosis control mode, where a lot of AI related stuffs are happening. We will see some of the case studies as we move ahead in this particular session. Okay, so why AI? Actually, public health is not something new, right? We right from the evolution of the humanity, right? Since we had a huge populations, right? Since we had the cultures living in one particular places, when people started talking about public health, right? When a large group is there in one place, there is a possibility of a disease, and public health is necessary. Now, why suddenly AI here? Here now we have exponential growth in the health-related data. Like, for example, we now have all information related to the vaccination. We have all information related to people undertaking a particular medicine, and many of the government institutions or tertiary care centers, they are having electronic health records where we can collect so much of data. Of course, we are respecting the privacy of the people also. We will talk about that also in the course of time. So exponential growth is there in the health related data. Today, data determines everything, as it has become a fashion to tell that data is the new oil. I will say that data is the new oxygen. Today, the communities are living on data. It is the data that actually determines the quality of the life. Just a day before yesterday or 2 days back, we saw that how half of the internet was down suddenly because of one single problem somewhere in some data centers related to the Cloudflare. So that the entire internet, the half of the internet came down, and we saw the repercussions. Suppose what happens if suddenly if it continues for 2-3 days, then our entire life will go for a toss. I mean, I always used to say that today no internet is no more a digital platform. It is the operating system of the human life. Our life runs on the internet. You just imagine what are the things that we are doing on internet in every day. It has become like the operating system for our life. So therefore, we have large amount of data. Everybody is generating data. We are generating innumerous amount of tremendous amount of data. So then this first reason, when we talk about big data, naturally AI comes into picture. The second thing is we have to take decisions in real-time mode. That is, all this data is there. We can't allow someone to look into all this data and come to a conclusion by analyzing it for 1 week, 10 days, 20 days, or 1 month. Sometimes we need to take decisions instantly. So when we only depend on the human analytics, then it becomes difficult. So we need to have patterns, or sometimes the hidden patterns are there. So these hidden patterns, they just AI is very good at finding out these hidden patterns. The entire AI is kind of a pattern matching. So where the human eyes cannot catch up certain patterns, but the AI can catch up these patterns very easily. So therefore, it will be easy for us to take real-time decisions during the crisis times. Again, I will take the example of the COVID-19. Like, we don't have time. Suppose the COVID platform example itself you take, if the team that was developing that particular project, if they had said that we will need 1 year time to build up that particular platform, then that platform would not be of any use, because 1 year is a long time when we are in a crisis. They built it up so quickly and it came live, and many of us do not even realize that it is such a big work. Because you see, 100 crore people accessing a particular platform is not a joke. Many countries in the world will not be able to do that kind of scalable work. That was a great work that our people did during that time. Another reason is that we have shortage of the health workers in many regions. Of course, this is also something that we have some case studies where even if you take some of the African countries where they have things such as how the pregnant woman's health is taken care with the help of AI bots, etc., and they have developed some sort of stuffs where it is helping and giving them wonderful solutions. And the last one is the demand for more equitable and efficient interventions. This means that when we build the technology, this has to become accessible, and it should not create something called digital divide. Like, we should not divide the population into two groups where one group have access to all these kinds of high tech, and another group where they don't have access to any of these things. Again, thanks to our governments, that we have now created a network where in remotest of the remotest villages in our country, we have internet connectivity, and where the government is able to reach its particular thing. You know that how this direct benefit transfer scheme is working, where at a push of a button, we can make this money transfer go to millions of people at an instant of time. So therefore, the technology in our country, the Digital India platforms that we have built, is really making a great stuff. And even I will say that when the Digital India project was launched, earlier there was kind of skepticism that people said these kind of things won't work in the Indian setup. But today, down the line 10 years, we see that everywhere we use this kind of digital tools. It has become like a second nature, that people don't even keep money in their purse, because they just can scan anywhere and everywhere we are able to access it. So demand for equitability, this is very important. Before we move ahead, I want to say that the AI is a tool. It is not, you might have observed that from whatever I'm saying, it is not a substitute for the public health expertise. That's something that we will discuss in the next few slides. Okay, so what is artificial intelligence? So AI, it refers to the computer systems that were capable of performing tasks that typically requires human intelligence. What does that mean is that before the AI thing came, we just thought that computers are good at automating mechanical tasks. That is, we thought certain things are mechanical, such as accounting, file keeping. These kind of things does not require any imagination, and therefore we can just automate them, and we can give it to some computer. But we were of an opinion that certain things requires imagination, and those things cannot be automated. And we thought those are human only abilities. For example, writing a poetry, creating a painting, writing an essay. These things we thought that it can never be automated because they require the human intelligence and what we call the sixth sense. But then slowly, what is happening is writing a poem, creating a painting, and creating music. All these things are slowly getting done by the AI. Though we call simply the word AI, we have different types of AIs are there. One, we have narrow AI, or sometimes we can call it as weak AI. They do only one task. They are not good at generalization. If you ask this AI will do only one particular task, and that one particular task it will do nicely. But if you take humans are not good only at one particular task. The same person will be able to perform multiple roles effectively. This we call as general AI. Otherwise, we call it a strong AI, or we can also call this as AGI. AGI stands for artificial general intelligence. Like first we had narrow AI, where the intelligence is limited to doing a particular thing. For example, it can be image recognition, or it can be language translation, where it will do only that thing. It does not know anything apart from that particular task. That kind of things, those kind of things are called narrow AI. Now we are having something called the strong AI. The strong AI is the hypothetical systems with human-like reasoning. Of course, we are slowly nearing the general AI or the AGI. Many companies are claiming that before in the middle of the next year, we will be having the AGI. There are contradicting claims are there. We have to wait and see. But one thing for sure is that if you look at the human history, always the changes are happening. But what is new now is the speed with which these changes are happening is really unprecedented. Like every week, literally, something new is coming up. As a person who is closely observing AI, I can tell with confidence that what was not possible 2 weeks ago is now possible today. What is not possible today might be possible by next week. This week level updates are happening. Like you all might have used this Google's Nano Banana, what came recently, where initially when the image creation tools came, people said these images will be like looking very murkier, and they won't look very realistic, etc. But suddenly within a year, what happened is Google came up with this wonderful tool called Nano Banana, and now people are like creating images which you cannot distinguish whether they are really taken or they are AI related, AI generated images. That itself is creating a huge problem, because how are we going to ensure what is the actual content, what is the fake content also. We have that problem also is there in the public health related stuff also. Of course, in relation to public health, now we are having the general purpose, the narrow AI, where it does particular task. But slowly what will happen is we will have the new AI that will be taking over this. Though suddenly we talk about AI everywhere, AI is not something that's very new. AI is born before most of us. The birth of the AI as a field happened in 1950s, where Alan Turing and the popular Dartmouth conference, where they started talking about the new systems that they called as the AI systems. And then people started talking about the expert systems in 80s and 90s. You see, the AI is like waves in the ocean. One wave of AI comes, the enthusiasm goes great, and then suddenly an AI winter comes. Like then people realize that okay, all these things that we thought is not going to happen immediately, so they go back to the normal mode, and then again the next wave comes. The next wave will be bigger than the earlier wave that came. This is what happened in 1950s. The first wave of AI came. These systems were not that much effective that time. In 80s, again we had expert systems. In 2010 to present times, we have machine learning, deep learning that are driven by the big data and the computing power. Now, what has suddenly changed now is that computing power has become easily available. Data is easily available, and everyone is having a mobile device in their hand, so that we can put this final thing into their sorry we can put this final models into the user's hand. A minute. So this is the advantage that we are having now. So the enablers of the modern AI is that we have electronic health records, as I said, and then we have mobile health and wearable devices. This is another interesting thing that we have, the wearables. Like nowadays, we all have this Fitbit and the watches, etc., that gathers our data throughout the day, and then therefore this can be used very effectively for making predictions, etc. And finally, we have this cloud computing things that I've set up. Like though we don't have the huge computing power, we can just outsource it to a cloud, and then we can use it from there. And then many of these algorithms are open source algorithms also. So therefore, we have the things that I've set up. What was not earlier available, all those things are available now. Therefore, we can very easily use these AI systems effectively at this point in time. So this wave of AI, now also people are talking about, are we in a AI bubble? Like you might have heard that many people are saying that this AI bubble will burst soon, and then we will have reality sink in. But if you ask me personally, now with the earlier waves of AI and the current wave of AI, what is the difference is that in the earlier wave of AI, the end users were not involved. Like it was only the enthusiasts, academicians, and the research people. They were interacting with the AI, and they were like forecasting so many things. But in the current wave of AI, we have already given the AI to the end user's hand. They have already started using it. So now taking back will be very difficult. So we will be having at least a common floor below which we cannot, down which we will not be able to go. Okay. So if you compare the AI and the human intelligence, and this you can say the strength of the AI is that it processes the large data rapidly. And here with respect to public health, the patterns that we are talking about, these complex patterns that we can talking about, it's very, very essential. It can very easily detect these complex patterns. And the AI will operate continuously without fatigue. That is one important thing, because AI need not sleep. This is an important statement that the AI scientists, computer scientists are now talking about. We have an intelligent creature which doesn't need to sleep. At first time in the history of the humans, we are having a competitor to our intelligence, and which does not require, which does not sleep, that it can learn continuously. So it can work without fatigue also. But the limitation is that sometimes it can, the contextual understanding might be missing, and it cannot exercise empathy or ethical judgment. In public health, this is something very, very essential. Like the AI systems, of course, they show some symptoms of the empathy, but those empathies are like artificial. The intelligence itself is artificial. So the empathy itself is, I hope you all understand what I mean by empathy. Empathy is like thinking from the position of the person who is undergoing that problem, like realizing that problem, that if we undergo that problem, how we will feel, that emotion, that we call it as empathy. And ethical judgment. And sometimes, yeah, I was telling you about that image creation AI stuff, where if you see this image stuff, we have to put a line where beyond which it might not be ethical to do certain things. But technically, all those things are possible to do, but who is going to put that line? For example, recently OpenAI, the company which built the ChatGPT, they have come up with an announcement saying that don't discuss your personal problems with the AI. Many times, the people are now started talking about their own problems with the AI. This year, middle, I was attending an international conference where 300 plus applied psychologists throughout the world they came, and I gave a keynote address in that session talking about how AI is going to help the applied psychologist in doing the counseling and stuff like that. And most of them they said that globally it is the trend that people are now talking about their innermost problems to the AI models. And whether it is ethical or not, suppose if a AI model tells you that don't worry, I am there for you, what does that mean? If when a human says, when a counselor says, when a counselor gives affirmation, then it has some meaning because it's a human to human communication. Now an algorithm is telling you that don't worry. What does that mean? So these are the global questions that we need to address. Health does not mean only the physical health. In the public health, one of the major component is mental health. Today, the thing is there are specifically designed tools are there on public health bots are available. The mental health bots are available where people are started discussing about this problem. Now, how do you put a line that don't discuss this? Or if we tell them whether they are going to listen to it, so that is also another complex problem that we are having. Okay. So the major health challenges, if you talk about the major public health challenges, the epidemiological shifts. Now we are having rising burden of the non-communicable diseases. Previously, we were having problems related to only the infectious diseases, where the communicable diseases were becoming a problem. Now we are having, earlier at least we are having the problem of the malnutrition, etc. Now we are talking about obesity kind of stuff, and many non-communicable diseases are on the rise. So how are we going to address all these things into, now you might have seen governments are very much aware that they are telling that even the food habits, how people are need to change. Even our Prime Minister said in the recent address that everyone need to reduce the intake of the oil, that oil means the cooking oil. They are even announcing it as a challenge, like reduce the cooking oil level at least by 10%, 20%, so that these non-communicable diseases, what you are having, like the heart diseases and obesity-related diseases, they can be controlled. How government is coming to that kind of conclusions is they are collecting data from all such places in so many different areas where these tertiary care centers are there. If you take Pondicherry here, we have a huge center here called JIPMER. Similarly, in Delhi, we have AIIMS and so many different that kind of centers over there where the doctors deal about the complicated stuff, and we can easily pattern match what kind of patterns are there, what kind of things are there. So based on this, now government is able to even directly give suggestions that do this. And we are also having this systemic issues also, the persistent health inequities across the race, income, and geography. So though we say that the technology is like here the technology is a great enabler, but of course some people are more susceptible to diseases, and some people are not able to take care of themselves due to the geographical conditions or due to the income related stuff, etc. And another big thing that we have is this aging population. Many countries in the world are now facing this issue of population aging. It's a great problem with respect to the public health. If you take some of the European countries where the public health, the aging population, how you are going to take care, because many times the governments are given the responsibility to take care of the aging population, and how they are going to do it, it's becoming a big burden for them. Currently, as of 2025, India's we have the demographic advantage that our average population age is very less, but it is not going to continue like this, right? If you move forward another 20 years, India will have a huge population with the age above 60 or 55. So then, how you are going to handle these kind of aging populations and their the strain that it is going to put on the health systems, because these people will have affordability, they will be having their own, they can afford their health care, but how the healthcare systems and the public health systems are going to undergo this stress or the increased demand, how are they going to undertake this? That is a big thing with respect to this, one of the great public health challenges that we have. Funding and workforce shortages is also another problem that we have. Okay, so now come to the data landscape, directly into the business. So far, whatever I told you, it's like the context under which the AI and public health are related. That is the link that we have established so far. Now let's take the data landscape. From where the data comes? The sources of the health data are primarily the clinical records, the hospitals and clinics, from where we can collect the data. And whenever we collect the data from any clinic or any hospitals, we have something called this data blinding process, that is anonymization of the data. Like, as I said, we are working closely with the JIPMER. But if we simply walk into the JIPMER and we cannot tell them, okay, give all your scan reports so that we will just digitally convert it and we will use it for our machine learning models. They won't give, because they are not allowed to give. Even one patient data, they won't give with the patient's name, age, and whatever personal information that they are having. All this information are considered very sensitive. They won't give that kind of data. That is one important problem in the clinical AI, that how we effectively do this anonymization process so that it won't, it will perfectly do it. Because the thing here is that you can't do that entire anonymization process manually. Like, say, for example, you take a discharge summary and then put a sticker on the patient related details, and then you scan it. Like, how will you do this for 1 million people, 1 million patients? It's not possible, right? We have to do that automatically. But to do that automatically, we have to show them that our systems are not reading that patient data. This is one of the interesting challenges that we are facing. Anyway, the source of the data is this clinical records that we have, and then public health surveillance systems. Now, if you take Tamil Nadu or Pondicherry, we have this health surveillance systems are there. They will be coming door by door to see like what kind of problems are there, etc. So through which also the data is submitted finally to that ministry, and ministry takes the decision. Of course, through mobile phones and wearable devices also. Like one example that I told you is that the Fitbits, which count even the steps that people take, like every day, how many steps we walk. Sometimes now people are now counting those kind of things, and they are now mapping, like, is there a step count with the link of step count to a particular disease, or is it related to the duration to which they walk, or these data are very much reliable or not. Many success stories are there. Of course, there are some stories where we are not able to map the correlations. Those kind of things are also there. And from social media and search engine queries also the data comes. Say, for example, if in a particular region, many people are posting about in the social media, for example, the symptoms of flu, then that means that there is something wrong with that particular region, or people are searching for like a particular medicine throughout a region. So the search engine queries are also providing the data for us. And of course, the final thing is the environmental sensors. Today, every city, we measure the air quality index, the AQI. And you know that now, unfortunately, what is happening in some of the North Indian cities, that that the air quality index somehow is very less, and how those data is going to affect the citizens. Those kind of now what we have to do, that data also we are collecting with the help of the environmental sensors. It's not only about the air, it's about the water, climate, and all such stuff. So if you see this 1, 2, 3, 4, 5 different dimensions of the data that we collect from the clinical records, from the public health surveillance systems, from the mobile phones and wearable devices, from social media and search engine queries, and environmental sensors. And this data is constantly growing, and every day petabytes of data get generated. And this becomes a big opportunity for us where AI can integrate and analyze these diverse data streams for early warnings and insights. It is literally humanly impossible to gather all these data and to analyze all these data and come to some sort of a conclusion. And here is what the AI comes into picture in the thing. Okay, so sometimes when we work with the healthcare professionals, even they also have a kind of a fear that where this is going to go. Like now AI is doing this kind of a things. What it is going to do in another 3-4 years down the line. We talked about two type of AI. One is the narrow AI, another one is the strong AI, or the weak AI and the strong AI, or you can call it AI and edge AI. Next step to this one AI that we are all saying that there is something called SI. SI stands for super intelligence. Like when super intelligence comes in, we are going to have the intelligence of the AI multiple times higher than the human intelligence. And it has never happened in the evolution that there was a creature which was more intelligent than the humans, or at least we thought that we are the most intelligent creatures in the entire ecosystem. If AI become more intelligent than the humans, what is going to happen? This fear is there everywhere. Even if you talk to healthcare professionals, you talk to lawyers, you talk to doctors, you talk to teachers, everybody is now having this particular fear. Even the AI community itself is divided into two categories. One group of scientists, they are saying that, okay, all these things are algorithms and data. We never need to worry about the AI taking control. But some of the scientists are predicting that no, it cannot be taken, it cannot be given like this. One reason they are all telling is that many of these AI models, they are giving some suggestions, they are giving some solutions. For example, if you ask ChatGPT to write a particular essay on public health, now one essay will come. Now, why that essay is coming at that point in time, nobody knows. Nobody means, including the people who built the OpenAI, who built the ChatGPT, no one knows that why that particular essay is coming. You ask again, some other essay will come. It is not the same thing. Why at that instant in time, this essay is coming? We do not know. And this essay is not available anywhere. It is not, you cannot just copy that and then search in the Google to find out what is the source. It has built that content. And this is called explainability problem. We are now talking about interpretable AI. And this is a major problem. If you see, if you take a car or any machine for that matter, we know nook and corner how and why that component is there and how it is working. But in the history of the humanity, for the first time, we have invented something which we do not know how does it work. This is a great challenge that we are having. Like how it is going to go ahead, that people are taking the thing. But of course, this is one group of people, they argue like this. Another group of people, they simply say that, okay, these are exaggerations. You don't need to worry about such kind of stuff. You simply use it whatever is available. So in that perspective, the AI can be a great support tool. So the core principle is AI as an augmenting tool. Augmenting means like to assist the person. Like how we use computers. The computers simply made our work easy. Like that, AI can be an augmenting tool, not to replace. That is the point. Of course, public health professionals cannot be replaced, but there are certain professions where the AI can totally take over. That's the problem that people are talking, that now the job loss that they are discussing with respect to AI. For example, this customer care. This customer care is some job that within a short time that AI can effectively do without any fatigue or without any problems, because now it is able to understand what you are speaking, it is able to understand the context, and it is able to give the answers also. That kind of jobs are really in trouble. But however, if you see throughout the history, technology has always replaced the job. Like if you are above the age of 40, you might be aware that in our life we have seen a thing called STD booth. But today, if you see, there is no STD booth, because everyone carries 2 STD booths in their pocket. We all have our own mobile phones. We all have our own SIM cards are there. So STD booth STD booth was a big business. Similarly, you had something called browsing centers. Now there is no browsing center. So technology creates new jobs. After a point in time, those jobs will disappear and new jobs will come. This is happening throughout the history. So we don't need to worry about it. So therefore, it is not to replace, it is to augment, it is to support. So the prerequisite for success in the public health domain is that we should have high quality data and the data should be representative data. What is meant by this representative data is, for example, since I said we are working with the dermatology department, I will just tell you one example. Let's see, if you take any skin disease, if you see the data set that is available, many of these skin data sets, they're all having this light skin, like the Europeans and their kind of a thing. If you come to Indian continent, our skin pattern and color is different. So if you just take that data set and try to make some sort of a train some model with our disease population, it won't work, because you have taken a sample from some other population and you are trying to apply the thing to different population where this data is not representative. So we have to have the data which is both high quality as well as the representative sample of the particular population. Of course, we should also have a clear a definition of what we are trying to achieve. We should not vaguely say that, and AI is not this snake oil, like what they call earlier, they had something called snake oil, which is like one solution for all the problem. It is not like that, right? We need to define for what we are trying to apply this. So we need to clearly define, and we have to integrate into the existing workflows. Of course, we have to also see how it is going to effectively work with the thing. Okay, so now come to the this thing. The transparency and the explainability problem. This is what I was explaining you, elaborating you so far, that AI is coming up with some solutions, but we do not know that how it is exactly coming to that solution. See, earlier when we were writing computer programs, we can exactly follow the process, and how it has come to a particular solution we can trace back. And we can for sure say that the system's output given a particular input. But with AI, that's not there. The same input you give, now it gives a different output. After a few minutes, you give the same input, it will be giving a different output. So these systems have become more kind of stochastic, and we are having different kind of outputs that are being generated. So there we have a problem called black box problem. Suppose if AI is giving you a suggestion, and if you do not know why and how the AI has come to that conclusion, how much you can believe that? That is the problem. Because now you can't tangibly explain how AI has come to that problem, because it has seen the data in a multidimensional way, and with already existing trained model, with some sort of an inferencing, it has come to some conclusion. But how are we going to say for example, if you are a person who is working at the crosscut of public health and AI, and you have to give a report to the ministry telling that there might be a problem in this region, you cannot simply write one line and then say, okay, there can be a problem in that particular region. You need to say why and how you come to that conclusion. And that problem is what we call it as the black box problem. The solution for this is, now we are thinking about something called this XAI, which is called explainable AI systems, where this explainable AI systems, the AI system itself will tell you why and how AI came to that conclusion. If you are, I will tell you a simple example so that you understand this. For example, now you are walking into a bank and ask for a loan. If the bank has implemented an AI system, so the bank manager will simply provide all your data into the AI model. If the AI model tells you that this person is eligible for the loan, the bank manager can blindly give you the loan, because he has just followed the decision of the AI model. But if the AI model tells that you are not eligible for the loan, and if you ask the bank manager, why are you denying me this loan, he might not be able to explain you in detail why he is denying that particular loan. Of course, now he can take a decision overriding the AI model, but then if something goes wrong, then he is responsible. So that is the problem that we are facing here. So people, sometimes what they do is, they just rely, okay, okay, this model is telling, let's believe. In bank loan, maybe you can approach a different bank. But similar case studies are there in US, where in legal setup, they have applied AI, and many judgments with heavy influence of the AI stuff they are now experiencing. So legal is the next level. But if it comes to healthcare, this is the problem of life and death. Here you cannot simply say that we just follow the model's advice. You cannot say like that. That is the problem. And this is what I am saying. So decision makers must understand how predictions are made. Like, you are a scientist, you just go and tell to the ministry that, okay, this is the prediction I have made. They won't listen, because you have to give, unless until you give a solid logic for how did you come to that conclusion. And of course, not only the decision makers, the affected communities also deserve explanations. You have to explain to the community on which you are applying this decision. They also will ask for the decision. So one of the problem, or one of the important ingredient of the public health AI is transparency and explainability. This is something very, very essential. Okay, so another issue is, don't think I'm just only talking about the issue. There are some case studies are also there, because see, AI is a very powerful tool. If a tool is very powerful, and if we misuse the tool, the impact will also be very high. So therefore, before misusing AI, we have to understand what we are doing. Like, see, humans, when invented the nuclear bomb, they didn't understand the kind of impact that it is going to create. And they just tested it, and they attacked countries with this kind of thing. Then only we realized that it's something very huge which can go out of our control. Thereafter, we learned, okay, now we should not go like this. We have to be very careful. The same mistake we should not be doing with the AI also, because AI is, of course, it can create the kind of impacts as equal as the kind of impact that was built by the nuclear explosions kind of thing, if wrongly used. That's why we are talking about all these kind of things. Say, the two problems that are there is, one is privacy. Privacy, I already explained in detail, like the patient data anonymization, all these things. So re-identification is also there. Unauthorized access is another risk. So you can, and this is called function creep. What is function creep? Is like, you collect data for one purpose and then later you use it for some other purpose. Then that is not allowed, right? So that is also something that we have to take into consideration. The best practices are, we have to obtain informed consent. Say again, I will give you that the example of the dermatology model, that when we built that model, we just asked every participant who participated in that particular thing. We got the informed consent from them. What are we doing? Because this is very essential. And then the minimization thing, like, what is necessary, only collect that thing. Don't collect everything. And of course, we need to also apply the encryption and the data, the secure storage thing, because you might not have any wrong intention. But if you just put the data in some place, and if a hacker gets control over the data, and this healthcare data is a big business. Like, suppose if an hacker comes to know who are all the people are taking a particular medicine, then they can manipulate the pharmaceutical thing, that like this much of need is there, so therefore can we do something like that. So that comes to this level of problem. Of course, we have to comply with the regulations also. Now we have this GDPR, where privacy is taken very, very seriously. Okay, so now come to the applications. So first I said the overall context, then we discuss about what is critical. Now we are going to see into what are the different applications. So now how AI helps is that we can do something called disease surveillance and outbreak prediction. Outbreak prediction is that one good example of this outbreak prediction is this Blue Dot, which gave early alerts for the COVID-19. Now we also have this Google Flu Trends, where it's one of the pioneer in the digital surveillance technology. Surveillance is not closely monitoring people, where we use one word called surveillance in the privacy related stuff. But here we mean surveillance is that before something happens, how are we going to predict that this kind of problem is going to erupt? So we can analyze the real, like how your simple example is how your Google map is giving you this traffic data. Like if you are asking for a direction, it doesn't only give the direction. It also tells you that there are two ways are there. If in this way, if you go, there is huge traffic is there. It may be a shorter duration, it may be a shorter path, but it will take long duration. So you take another path. Now it has become a part of our life because we believe the Google Map AI, that the Google Map AI, when it says, it will be correct. We have come to that kind of level. The same level of confidence that we need to build for the public health AIs also. So it can also detect unusual patterns. Sometimes, say for example, the number of people coming with the flu symptoms to the emergency ward or a particular hospital, if the load is, say for example, every day only 500 people come, suddenly in 1 week it becomes like 1500 average, then you have to come to a conclusion that there is something drastically going wrong. Of course, there can be some outlier, like in 1 day something happened, that is not a outbreak prediction. But if the trend continues, and if the running average is above your normal level, then you need to come to a conclusion that there is something wrong is happening. So this blue dot and the Google flu trends are one of the examples of the public health digital surveillance. Okay, second thing is we have this medical imaging and diagnostics. For example, we have this automated analysis of the X-rays. Like this is one huge example where you know that reading some of these documents becomes very challenging. Like you need to have the expert available at that particular place. See how things work now is that if you go to a village level and if you don't have there will be public health setup will be there. But you can't expect an expert will be available over there, a specialist will be available over there. So, but if we give this AI tool to that general practitioner and to that public health person, and they use this tool, say for example, if a person is coming with an X-ray or something, if we do an automated analysis of this X-ray and the retinal scan and ultrasound, and if the predictions are something wrong, then we can suggest it to the expert care. And one of the experiments is that in neonatal care and the pregnancy care, nowadays this kind of steps are applied. So therefore, we can increase access in the low resource settings. So what we mean by low resource setting is that where you don't have access to the specialist to whom you can directly talk, and it can also reduce the diagnostic delays. Because say if 50 people are coming with that problem, and if your AI model is sidelining 5 people or identifying 5 people as potential risk, these 5 people's report you can just forward it to a tertiary care center and then try to get the opinion of the experts, and they can be further advised to do and follow-ups and etc. So this kind of a model, not like directly giving to the patient and they themselves take a decision, trying to include this setup into the public health network, and through this network we will be able to do the things much better than what we were earlier doing. And this personalized health messaging also, this is also tried in some community profile. For example, now we can build a AI system that can tailor health messages based on individual or community profiles. For example, if you see that in one particular region, if a similar kind of problems are arising, then you can find out the root cause and try to send out the tailor-made health messages so that they can be alerted so easily. For example, use cases are the SMS reminders for immunizations or medication adherence. This is something that is now happening already. They are setting up the SMS reminders for the vaccinations, etc. And also medication adherence. For example, if you take the elderly population, where they may be sometimes they will forget that they have to take a medication at a particular point in time. But now if you have an app or something that alerts them that what medicine they have to take, and even there are apps such as Pill Reader where they can read what medicine they have to take at what point in time, etc. These kind of thing. Also, we can generate the culturally adopted nutrition advice. This is something that's now getting momentum. For example, if you are giving a health advice or diet advice to a person living in Pondicherry, but if you have taken a model from USA, and based on that model, we cannot give the nutrition advice to a person living in Pondicherry, because here we have a cultural aspect, and here we have our food patterns are different. Here our mechanisms are different. So we have to be culturally more relevant on what kind of advice that you give. So you can't just take the data from elsewhere and just take those messages we just give. And this cultural significance plays a major role. And then only people will understand. You just tell them what they are already eating, and based on that, what need to be changed. We cannot simply tell them some European food and include this thing into your diet. Most of the time, this will fail. And of course, mental health support via chatbots. This is a very tricky thing, that mental health is becoming a major concern, particularly both in the elderly population as well as in the children and college going people also. And if many of you are teachers, you might be aware that every institution now we are very sensitive to the mental health issues of the students. And we appoint counselors, we appoint so many different, we create so many different setups so that their mental health things can be taken care. You see, I don't know whether the previous generation would have faced this kind of a problem. They would have not talked about stress as we are talking about stress. If one word that we repeatedly use these days, whoever you meet, they will be telling that it is like stressful, it is like more work is there, they are burdened with the work, etc. Everyone is facing that kind of problem, or many people are facing that kind of a problem. So therefore, mental health becomes a very major thing. See, it's an irony that after the invention of the social media and the messaging platforms, etc., people should feel connected. But ironically, people are feeling isolated, and people are feeling loneliness. And this loneliness is also, even the American, the health people, they say that loneliness is now a silent pandemic, that people are experiencing loneliness like never before, and we have to do something. There is a vacuum over there. And in this vacuum, AI models are sitting in, and now people are started talking with the AI models. And this has to be controlled. That's what I'm telling. Like we cannot stop this, but there should be regulations on what you can talk to AI models. Say, for example, if you take suicide prevention. Now, if a person repeatedly talks about suicide to an AI model, you should have inbuilt alert mechanism which will alert the public health setup that there should be some care should be given to that particular individual who is repeatedly searching for suicide related stuff, or committing some harm to himself. Like if he is repeatedly searching the mechanisms, then this kind of a thing. This data is very personal. But here only AI only can help us, because you can't. Earlier time they used to tell that if a person is telling about this to some people, but nowadays they're not telling about to some people. I told you about that applied psychologist conference where we had some participants who said that they feel it very normal that people talking about their mental health problems to an AI model. They do it very regularly. And in this group also, many people you might have seen others who just talk about their mental health problems. Mental health problem does not mean only a disease. It's like even a simple thing such as the burden that you are feeling, the fatigueness that you feel, etc., on a prolonged period of time, then it becomes a problem. Okay, so another thing that where AI can help is in the public health, we can optimize the resource allocation. Like where we need more resources, where we need less resources, that we can that we can optimize, and this can be done with the help of the population density, historical disease incidences, etc., and socioeconomic indicators also. And in our setup, we also have these cultural aspects also. For example, during a festive season, there is a kind of problems that can happen in the rural regions, etc., where health hazards can creep up, or better sanitization facilities, etc., need to be provided. So we need to take care of those kind of stuffs also. Mental health, this Visa is one of the bot where many people are using it. This is for the initial screening. Like, see, feeling feeling low is a human nature. uh, you can't find anyone who will be like always very bubbly and always feeling happy. That's very common. But if a person is continuously feeling sad, then that is a problem. So that needs screening. So that screening should be done at a earlier stage before it becomes it becomes a problem. And this is even done with the help of this bots such as Visa, etc. This Visa is becoming very popular these days. And we also do the sentiment analysis of the social media posts. Sentiment analysis, many of you would have heard about. Like, if in many regions, if in a region many people are talking about a distressful environment, uh, then you call that as a community distress. Like how you have an individual person is having the stress, like that we have something called this community distress also. During this community distress, how can we how are we going to prevent or how are we going to assist them on time? This is something that we can look for it. And the benefits here is that it can improve the access. As I say, access means like the facilities can be easily provided, and it also reduces the stigma. The stigma is a big problem in the mental health. Like, people don't just walk on to a counselor as they walk into a ENT doctor. Even now in our society, we have attached some sort of a stigma to mental health. When someone is experiencing a mental health issue, the community does not take it lightly in some places. Uh, but those people need more help. But we don't do that, and because there is a stigma associated with it, like what happened earlier with the AIDS. So now it has been rectified. Earlier, that kind of a stigma was there. Now the same kind of a stigma is there with the mental health issues also. In this case, AI can assist us. Of course, all these things are not replacement for the clinical care. They also must include the escalation pathway. What is this escalation pathway is up to what level you are going to talk with that particular AI system. Beyond a level, you have to approach a expert care. Expert care is, now we are saying that, say, if it is a mental health issue, you need to be talking to a professional counselor who is already trained and who has well understanding of this thing. And many times, people end up meeting the ordinary people who call themselves as counselor. The psychological counseling is something very, very it's a very serious business. Only the trained people should be doing it. Of course, the environmental health monitoring is also there. We have talked about this one earlier, so we just move on to this thing. And another big thing where in public health AI has helped greatly is this success story of the AlphaFold. The AlphaFold can predict the protein structure. This Nobel Prize last year, we got the Hessabis, who got this Nobel Prize for detecting, for finding out this AlphaFold, developing this AlphaFold. This AI chemistry Nobel Prize went to an AI scientist. This really changed the way how the drug discovery is happening. How we are going to, in the words of Hessabis, he says that what has to happen in 100 years is now happening in 1 year. That much quick discoveries that we are able to make with the help of this AlphaFold kind of thing. We all have the impact of this thing. Many times, all these things are hidden from us. Of course, over reliance and de-skilling is also, now we are again coming into, if you overuse AI, what will happen? That is one thing. Like, if you always depend on the AI, the professionals may defer AI even when it is wrong. Like you can simply suggest to the AI model. And if it continues, then we may also experience something called this loss of critical thinking and clinical skills over time. So the mitigation is that design AI as a decision support tool, not a decision making tool. So this human in the loop protocol that should be always followed. Human in the loop is like no decision is automated, no major decision is automated without a human's approval. Of course, AI can greatly do one big damage to us, which is called the misinformation amplification. Now you all know the WhatsApp University, what it is doing. People believe, I don't know why, whatever comes in WhatsApp, they treat it as a big thing that they do is like they forward it to 20 people. So this creates something called this amplification of the misinformation. And AI driven social media algorithms, they prioritize engagement and over accuracy. So now what happens is, if some of this thing becomes popular in the Instagram, if the Instagram sees that many people are viewing it, that post will be boosted, and the Instagram will not check whether it is accurate or not. So this creates a big misinformation problem. This finding what is fact from what is wrong, it is like becoming a huge thing these days. And the bots can sometimes spread the anti-vaccine or fake cure narratives, etc. Some of the European countries have this concrete examples of this one. So this can sometimes reduce the vaccine uptake and compliance with the guidelines. Excessive surveillance is also a problem. Like if you are having excessive surveillance, then some people may treat it as violation of their privacy and liberty, etc. Okay. Now there is something called this automation bias. So what is automation bias is, humans have a tendency that machines will never commit a mistake, to believe that the tendency to trust automated recommendation over the human judgment. For example, now you are adding 10 numbers and you ask your friend to add 10 numbers and you calculate it in Excel. Mostly you will believe what Excel is saying. You won't, even though your friend is an expert in mathematics, you won't believe what he is telling. You once again cross check with what is there in the Excel result, because this tendency is called automation bias. Automation bias is, we think computers will never commit a mistake. That is not a case always. When computer was a calculator, that was okay. But today we are talking about taking judgments, creating new stuffs, etc., where we can't believe that kind of a thing. So here we have this the automation bias, or the automation bias becomes a big problem. Okay, now the next important thing is that I think we are running against the time. How much more time I have?
Having more 20 minutes, sir.
Okay, fine. Right. So now we will just do a small mental experiment. All of you, wherever you are there, you just close your eyes for a moment. Just listen to me. Just close your eyes. And now imagine that you are waiting outside a cardiology ward and you want to meet the cardiologist inside. There is a cardiologist inside and you are just waiting outside. You just imagine this setup. All of you would have imagined. Now, in how many of your imaginations the cardiologist was a male person? If you ask this question to yourself, I don't know how many people are there in this group. If there are 100 people are there in this group, around 80 plus people would have thought the cardiologist as a male person. But I never mentioned the cardiologist as a male. I just mentioned cardiologist. That's all. But how come we just automatically understood the cardiologist as a male? This is a bias. This is a human bias. Now, if I had said there is a nurse in the cardiology ward, this 95% of the people would have imagined that nurse as a female. But I never said it's a female nurse. This is a gender bias that is obviously there in our subconscious. We are not doing it intentionally, because many examples that we have seen are like that. Now humans are having this bias. in taking any decision. Bias means sidelining on one side, not objectively taking a decision. We already believing that this is correct, already starting to believe without looking onto the opposite scenario, then they will not be correct. You already take a decision, then analyze. Then that is called bias. Now, earlier, humans were having this bias. Now also we are having the bias. Now, AI algorithms are also having this bias. For example, if you ask an AI model to create the cardiologist image, AI model will also create a male cardiologist many times. And if you ask if you ask the AI model to create an image of a person writing with left hand, many times the AI won't create that image. It will create an image of it will create an image of a person who is writing with the right hand. Because out of the 1 lakh images that we have shown, 99.99% of samples are like that only. So AI models have inherently taken up this bias into the system. When creating an image, it is not a problem. Okay, we can adjust it. But what happens if such kind of bias into the public health things creeps up? Like we have biased training data, underrepresentation of a particular group. Here minority, we did not mean only the religious minority. Here minority, we means that the population, there will be some minorities will be there. Their cases are not considered. So the systematic errors in the AI will be there that will result in unfair outcomes for certain groups. So thereby what happens is you will have a flawed problem framing by developers and deployment in context different from the training environment. I told you, we face that problem like the skin color. If you train your model with European skin and try to develop a machine learning model to develop a disease prediction on the Indian skin, it won't work because the color pattern, so many things are different. They have something called dermatoscopy, where with that they just take a picture and then high resolution picture will be there. Whatever high resolution you take, if the data set is some other data set and you try to apply on some other context, this becomes a problem. This bias is a huge issue in AI now. Now, two things that we talk about AI very frequently is AI bias, and another one is the ethics in the AI. Yeah, here itself I have given this example. The skin cancer detection example. If you see this skin cancer detection, most dermatology image data sets are from light-skinned populations. For a light skin, how do you predict the skin cancer is entirely different on a dark-skinned populations like India, Africa, etc. So the consequences, the AI performs poorly on the darker skin tones, not because it cannot identify on the darker skin tones. Because of the data sets that we have given to the AI, it has been become like this. So this delays the diagnosis in black and brown communities. The lesson is that algorithmic performance must be validated across diverse populations. So that is a big issue. It's a simple example that I have given, like the color of the skin. Like that, so many different things are there. If you take the food pattern, say the kind of fat intake that they are talking about, what kind of fat that we are eating, what kind of fat that American population, how much they are eating, they are different. When we talk about avoid fatty food, how much of fat our population is consuming, how much of fat they are consuming, their suggestions itself is very different. What kind of fat that we eat, etc. So we cannot just take one training example and then try to apply it to some other context. So there are many different biases are there in the public health AI. The common forms of bias is that historical bias. They reflect the past inequities. Like throughout the history, it is like this only. For example, throughout the history, many times the cardiologists are the male. So you also imagine that the cardiologist that I mentioned is also a male. So this is called unequal access and representation bias. Certain groups will be missing from the data. Suppose if I say a police is chasing a thief. Now, if you imagine this, the thief that you have imagined will not be having a very fair skin. Most of the time we imagine the thief will be like having unclear features and a very dark skinned person. This is a representation bias and we are not intentionally doing it, but unfortunately this has creeped into our system. Now this is creeping into the AI models also. It becomes a problem. So certain groups go missing from the data. And measurement bias, the data collected differently across the groups. You collect data in one way with one group, and another way with another group. Then it creates something called the measurement bias. And finally, we have something called this aggregation bias. In the aggregation bias, we sometimes take a thing that we take a decision of one size fit all models. Like it's like I said, now the snake oil example. One solution for all the problems, one medicine for all the diseases. Like that, nothing like that exists. We have to find out the problem specific stuffs. Okay, how do we mitigate the bias? So we have to use balanced and representative data sets. We have to apply fairness aware machine learning algorithms. What is fairness aware machine learning algorithms is we need to see what is fair, and this fairness is a big story. I can talk about it for a long time, but since we are running out of time, I'll just move on to the next thing. So we have to include diverse teams in the AI development. Nowadays, you see that this inclusion is the inclusion is considered to be a very, very important ingredient of innovation. Like if any team need to innovate something, it should be inclusive. It should have a diverse group of people. It should have representations from various different type of society. Such teams only will come up with innovative solutions. If you build a uniform team, it's very, very difficult to come up with the innovative solution. The same thing is true with the AI developments also. Okay, another big problem with the AI is something called hallucination. What is hallucination is? The hallucination is that AI makes a very bold statement very confidently, very bold wrong statement very confidently. It is like a student who has come to the exam without studying anything. He will write anything and everything on the answer sheet without even worrying what he is writing. In the same way, sometimes AI writes some statements very confidently. It will tell you. You might have experienced, all of you would have experienced this if you are working with ChatGPT, Gemini, Claude, etc., where you could have seen that sometimes AI make this bold statement, wrong statement, very, very, one example that we have given, drinking bleach cures coronavirus. It was fabricated by a chatbot, and if this misinformation in our own places, we had a similar equivalent, like you have to drink this garlic water, etc., which will cure the coronavirus, etc. We had kind of garlic is a medicine, but it is not a direct medicine for the coronavirus, right? So sometimes it can create the fabricated messages. This hallucination is a big problem in the generative AI, and in public health, if you apply the AI and if the AI start hallucinating, things become very serious, right? We at one point in time we might not be knowing what is factful and what is hallucination, and people are now working. The AI scientists are now working to come up with the solutions where hallucination can be minimized. If not brought to zero level, hallucination can be minimized. So two things is that one is bias, another one is hallucination. Two major problems. Why it matters in the public health? Because it can give a false medical advice. It can undermine the evidence-based public health messaging. It is hard to correct once the misinformation spread. That's a big problem. And one big problem is that the misinformation spread faster. When the government is trying to create awareness, they spend a lot of resources and a lot of money on doing that. But misinformation without any backup, misinformation spread. How it happens is because of the people. And like this WhatsApp forwarding groups, some people won't be able to sleep if they don't forward at least 20 messages on that day. Some people have that kind of problem. So they will just forward anything and everything to all the people in their group. This is a great risk. If you don't know whether something is correct, then we will not be simply sharing with other people. And vulnerable population to this hallucination, AI hallucination, is these low literacy populations. Like people who already have limited literacy, they tend to believe that, okay, this WhatsApp is telling, no, if WhatsApp is telling, it will be true only. In WhatsApp also many content are now created with AI only. They just believe, okay, it has come in the computer. As I said, no, whenever something a computer says or whenever something is printed on a paper, we tend to believe that it is true. We don't cross check whether it is correct, whether it is correct or not. and areas with limited access to healthcare professionals. That creates a bigger problem because they will be able to at least correct them. Okay, this is not what you are thinking is not correct. It is not fair. They can give a corrective solution. But sometimes it is not there, then this bubble builds. Like everybody will be there inside this bubble and they all will be thinking the wrong one as the correct one. And to that kind of a group, it is very difficult to talk because they will have evidence in their hand which they received as the WhatsApp messages, etc. And they will be believing that. That is a big problem. So how do we reduce the hallucination risk is we have to do something called the ground responses in verified medical knowledge bases. Like you have to build the responses in the you have to build the data sets with the oh my God. So safeguarding is like you have to put this your data sets should be based on proper medical knowledge basis which follows the WHO guidelines, etc. We can avoid open-ended generative models for clinical advice. What is meant by open-ended generative model is that if a generative model does not have any limitation and it can tell anything and everything to you without any cross verification, etc., then it will be a problem. And we have to also include a clear disclaimer. This is not a medical advice. Of course, now what happens is in many advertisements, they would have included this. This is not a medical advice, but they will put in very small font somewhere down the line. We won't be able to understand that, read that thing. And route the high stack queries to human experts. And log and audit the AI output regularly. Log means like we have to trace what people are talking about, and we have to audit that output very regularly. Okay, now we have many case studies, but I will just take one or two things based on the time available. One of the successful case study that they have taken is in the flu forecasting in the US, where this CDC's FluSite network, which uses the multiple AI models that integrate the electronic health records, pharmacy sales, and the search trends. So the outcome is that the forecast flu activity 1 to 4 weeks ahead. So with that, what we can do is we can take a vaccine strain selection, and the resource planning can also be done by the local governments. So this flu is one of the things that repeatedly happen in the US, right? They take vaccines for the flu also. And in India, success story is this TB screening in India, which we have very successfully done now. The portable X-ray units with the AI analysis deployed in the rural areas. Like you have a mobile unit, mobile means not the mobile phone, like a mobile van kind of a stuff where they have a X-ray unit, and in that itself you will have a AI analysis also deployed. So you don't need to take a radiologist also along there to that village because radiologists are not there in that much number. So that AI analysis will look at that X-ray taken and it will flag the suspicious scans to the radiologist for review. So this has become like a huge success story in our country. We have the reduced the workload by many percentage. In Singapore, they have this dengue prediction systems are there based on the historical dengue cases, weather data, and human mobility patterns also. We are also doing here at Pondicherry, as I said, the dengue prediction or the prediction, the mosquito population based on that, whatever diseases are there with the mosquito related thing. Here we have something called this vector control research center. So along with them, some people in my department, they are working on this particular thing also. Of course, we have talked about this. I mean, this is the maternal health chatbot. There is a success story of this maternal health chatbot in Nigeria, where they have created an AI model, and they have even created a chatbot called this Agnes, Sister Agnes, which is an AI model. And these people who are the pregnant women, they can get their doubts clarified with the particular AI system. So you have to see that this is now becoming like a global phenomenon. We have seen an example from US, we have seen an example from India, we have seen an example from Singapore, we are now seeing an example from Nigeria. Of course, This opioid overdose prediction, opioid is like a painkillers. You can, there are some models that they have employed. So they will be able to analyze the EMS call, emergency calls and the prescription records to see whether opioid overdose is happening. Opioid overdose is one of the important problems, because you cannot be just like that to go and take these kind of pills and see that it gives you some sort of a relief. That becomes a big issue. Like in our places, we have this antibiotic resistance. For that also now people are doing this thing. And anything and everything, our people just go over the counter and buy the antibiotics medicine and swallow. That is not a healthy practice. Right now in many centers, if you go to proper hospitals like medical college centers, etc., they won't prescribe the antibiotics just like that, because it's having a long-term impact. So those kind of things also can be predicted with the AI subsequent prediction. I just skip this. So the core ethical principles is this: we have beneficence. The beneficence is maximizing the health benefit. Non-maleficence is like we have to minimize the harm. That is, we have to maximize the benefits. We have to minimize the harm and error. Autonomy, respect the informed choice and privacy. Because here we are talking about people and their health. And health is very, very close to everyone, right? You can't play with the health of the people by giving wrong advice or by doing some sort of experiment, etc. So therefore, it has to be taken very, very seriously. Justice. So ensure fair access and avoid exaggerating inequities. Like exaggerating inequities, that means that we should maximize the benefits to the needy people and minimize the harm and error. You see that we have not used the word avoid. Avoiding is not possible because sometimes it will be there, right? So the best practices, we have to involve the community, and we have to make it an inclusive thing. Conducting pilot test with the end users before making it available, and we need to explain them on how these things works in plain language. You should not go and talk like a scientist to these people when you are doing the experiment. You have to make them feel like, okay, this is something that they understand. Because when they have a fear, so many things goes wrong, and they don't follow your advices when they have the fear. And we need to also establish the feedback mechanisms for concerns. Like if they are undergoing our experiments or suggestions, if they come across any problems, how they will provide the feedback. So that also need to be taken into consideration. So what are the emerging trends is like, we are having one emerging trend called federated learning. This federated learning is like through which we can, without sharing the data, we can train the models locally and then send this trained concern to the central system, so that your privacy of the data can be taken into consideration very easily. And federated learning is one of the current recent trend with respect to AI. So the overall thing is this: we have to take a balanced outlook. AI can make the public health more proactive, precise, and equitable. So this is an opportunity. The responsibility is that the success depends on the ethical design and also the inclusive data and human oversight. Oversight means like we have to have a human monitoring that particular system. Final reminder is that technology should serve the people, not the other way around. That is, once we start using the technology, it should not become like the technology start using us. What is happening with the social media now? We are not using the social media. Social media is using us. We should not make it happen in the thing. So this I already explained you. So the final thought is, AI will not replace the public health professionals, but public health professionals who use AI better will lead the future of the health equity. That is, it is the golden line with respect to AI, not only in public health, anywhere. AI is not going to take away your job, but a person who uses AI better than you will take away your job. That's the point. So here we are now not in a point that whether AI is needed or not. We have crossed that point and we have come a long way. Now our point is not whether we need it. Our point is how, and how effectively and how efficiently that we are going to use it. So that is a thing that I thought of telling you today. So thank you very much for patiently listening to me. If we have any time for the questions, we can take 1 or 2 questions.
Thank you, sir. Participants, if you are having any questions, you can ask now.
Okay, I guess they don't have.
Sir, actually, you have explained very nicely about the types of bias and ethical considerations and the limitations on the data set. Actually, we are still using the European or Western countries' data set for our research purpose.
Yeah.
How can we overcome these limitations, sir? As India is one of the emerging medical capital of world, many foreigners are also coming here to get the treatment, and we are having such eminent healthcare experts. Still, why we are lagging in public quality data set for our research purpose?
Okay, ma'am, actually, if you see this, there are certain things called this low-hanging fruits. Like if we, many of our IT expertise is utilized in the service-based industry. Like they just work for some customers in the US or Europe, and they just develop a service for them. But when we wanted to do a research level projects, it takes a longer duration of time, and many times there is a possibility these projects can fail also. So now the trend is slowly changing, and government is also mobilizing that don't go only for the low-hanging fruits. Try to do something that will have a everlasting impact, and we will build something solidly here. Many of these systems that we are talking about are not Indians, right? We sometimes simply say that Arvind Srinivasan is an Indian. He studied in Madras, etc. But they are all now working for the US, right? So here, what we have to, as a teachers, what we have to tell it to our students is that we need to tell them that the contribution to our society will happen. We have to start it now at least, and it will take some time before we see the immediate result. In our case, what we did is we built our own data set, and we collected the data set manually for our project with the dermatology department, and we created the data set. So, but the easy route many people follow is that when they want to publish a paper, just to select some of the publicly available data set, and anything and everything that you do with the Python, some result will come, and then you can just publish it as a result, which is not going to create a real life impact.
Thank you, sir. One of the participants asked the question. Could you suggest any trusted, any one AI tool for the public to know health awareness?
Okay, actually, if you take any AI tool for that matter, you can see that there is kind of this hallucination, and the bias is there. What is my suggestion to you is, suppose if there is a medical literature is available, and if there is some document is available which you are not able to understand, better go back to this Notebook LM. There is a tool called Notebook LM, and upload this file what you are having. Suppose you have some 500-page health report has come from the government, say public health report has come from the government, and you are not able to understand what it is telling. Don't ask ChatGPT, don't ask Gemini. Just put this into Notebook LM, and Notebook LM uses a technique called source grounding, where it will restrict the answers from only the sources that you have included, and thereafter you can start conversing with that particular Notebook LM tool, and you can get better information on it. But blindly believing the content generated by the generative AI, many times it will be having this hallucination. So that is one issue. But you can, we do in our research team like this only. Like whenever we have a huge literature available, we put it into Notebook LM, and then we try to do conversations on it and try to develop some inferences. The same thing can be converted into a mind map. You can convert into a podcast. You can convert into a video based tool, etc. All these things are possible. So you can try with the Notebook LM.
Thank you, sir. Another question from chat window. How to add privacy in learning? Federated learning.
Yeah, privacy is like one of the solution is going for a federated learning. Federated learning is like, suppose, for example, if there are 100 nodes are involved, we do something called this training at the end level, in the node level, and the trained model weights alone will be propagated higher, so that you don't need to send the source data. The source data will be there in your own system, and the AI will run locally, and it will send the weights alone over there. The person who is interested in they can check with this federated learning stuff.
Yes, sir. Another question that relates to our previous discussion. As in many foreign research papers, I have observed approved data from many institutions, many times approved by government.
Yeah.
Actually, why can't our governments support us by providing this open source data set, sir?
It's there, madam. Actually, data.gov.in site is there. We can go to that site and we can use this data sets. See, the publication itself is a separate topic which we can talk for a long time. When we run against the publication, it's not only the number that matters sometimes. Nowadays, many journals are tightening their screws, that they are telling that you have now ethical committees approvals are there. For example, particularly if you are publishing in medical AI, you cannot send a paper without that ethics committee approval. Like you should have a solid the work that we are doing with the JIPMER, as I said, there was like a huge ethics committee procedure was there, like what we are collecting, how we will use it, to what extent we will go it. So that level thing is there. Sometimes what happens is, in our institutions, etc., people just use some data set what is available, and they just send it to some lower level journals, and the lower level journals also publish. And more to say about the conferences, it is better less said is better about these conferences, because they just publish anything and everything, whatever the paper that comes to them. This is something called research spam. Related to data, now government has this platform, this data.gov.in, through which we can gather a lot of data.
Sir, as nations are nowadays competing in technological aspects, like
Yeah.
biological war, nowadays they are involved in technological war.
Yes.
So rapidly, there's a vast growth in that is unplanned deployment or development of chatbots, tools, softwares, etc. How actually we can't pass this rapid development, though it is a much needed one. How can we overcome the other side, that is negative side of this rapid development, sir?
Madam,
that is
actually, I
having
understood your question. So the thing is that sometime back, I think last year, there was even a large memorandum signed by around hundreds of AI scientists to pause the AI progress for a few months before we understand what the AI is doing. But it was not taken very seriously. Suppose if the US take a decision to pause, will the Chinese government will listen to that? It can't. It won't, right? That is the issue. Actually, we didn't talk about the geopolitics of the AI related stuff. For example, if in our country we wanted to locally train many of the AI model, we need large amount of GPUs. From where we will get this GPU? These GPUs are coming from NVIDIA, right? This NVIDIA is there in USA. Now the government there, they have put some limitation how much of GPUs that you can sell it to countries like India. Even if you are ready to give money, they will not sell. And even if you buy also, you need to provide evidences for what purpose you are going to use it. Sometimes they sell it by telling that you should not use it for research purpose. You have to use it only for this purpose, etc. This is the problem that the government is now very well aware. And now the semiconductor mission, what the government is running, they are trying to solve this problem. Of course, it should have been taken for 35 years ago, but at least now we are happy that they are doing it on a war footing, that they have understood the problem now. It is not that no more we will be able to only rely on the devices which are coming. It's not about money. Like if now suppose, for example, a big IT company decides that I want to put say 1 million huge money into, or say for example $1 billion into this, I want to buy all the GPUs. It's not possible. They won't give it. That is the thing. So now that's why people are now government is telling that build the India specific models. Our IT minister has said that by next year we will be having one India specific model will come. So that will have, in fact, you have a project called AI for Bharat. I hope you might have heard about it. They do wonderful work in the AI for Bharat project. They are having a thing called collecting the voice samples from so many different places, because India is gifted with huge number of languages. And to train the AI into local languages, I said the information should be provided in the local languages. Who will create this AI? We only need to create. Say we say Tamil, ChatGPT will speak, but I want ChatGPT. I cannot expect ChatGPT to speak Madurai Tamil. I cannot expect ChatGPT to speak Tirunelveli Tamil. This thing, it's entirely different. This has to happen only here. So this is what is now we are aware that, and now people are working on self-reliance and how to build self-reliant systems.
Thank you, sir. Almost 360-degree coverage you have given on AI in healthcare. And also, even though we exceed the time, you patiently and nicely explained all the doubts, clarified all our queries. Thank you so much for your time, sir.
Yeah, thank you. So to start, I mean, at the beginning, I told you that we will have some take-home points. I hope I gave all of you at least few take-home points which you can work on it. Thank you very much for patiently listening to me, and I would like to thank again the university for giving me this opportunity. Thank you very much.
Sir, one participant asked, is there any real-time data sets from India? Can you name some data set, Indian case data sets, sir?
Yeah, it is there, madam. They can easily find out. There are a lot of data sources are there. It's not like the data set is not like, madam, one particular thing. If they are, say, for example, if you take dermatology, under dermatology itself, hundreds of data sets will be there. It is not one data set. If you take diabetes,
Generalize, they didn't ask any specific data set.
yeah, endless data sets are there. They can just explore and find out. It's only thing is we have to explore and find out. And sometimes creating the data set itself is a research project. And many times our research, we have to entice our research scholars to understand that also.
Yes,
Like
we should also contribute to the society.
that's what I'm telling. Like you have to tell your research scholar, if you are guiding a PhD, first to make a data set, and you can publish data sets also in some papers. There are some journals are there which publish data sets also, or you can publish in Mendeley or GitHub, etc., where you can make it available.
We are always asked to use the existing data sets.
Existing data sets is only like yeah.
This point is something different that I learned today, sir. Thank you.
Okay, madam. Thank you.
Thank you so much, sir. Thank you for
your. Thank you.
Thank you. Pushpa, madam.
I just exit the meeting, madam, now.
Yes, sir. You can exit. Thank you, sir.
Thank you, sir, for your valuable presentation. Now, next session is on big data for population health management by Dr. Ashok Mathani, Professor retired, Government College of Engineering, Jalgaon, Maharashtra. I invite Dr. Ambikavati Mav, Associate Professor, Department of Computer Science, to introduce our distinguished speaker of this session. Ambika, ma'am?
Oh, yes, ma'am. Good evening, all. I'm very much privileged to introduce today's session speaker of Atal FTP, Dr. Ashok D. Mathani, retired professor of Chemical Engineering Department from Government College of Engineering, Maharashtra. He has 30 plus years of professional experience and 5 years of industrial experience. He has started his teaching profession in the year 1992 and continued until 2022. It's a whole of 30 years. He is expertised in the areas of energy conservation, water conservation, artificial intelligence and IoT applications, industrial engineering, entrepreneurship, industrial management, operation management, productivity. He He has published 3 patents and 100 plus papers in reputed journals, as well as 100 plus papers in various conferences. He has received 12 Best Paper Awards in the conferences and seminars held in IITs, NITs, and other AICTE approved institutions. He has contributed as a session chair in various conferences as well as a keynote speaker in faculty development programs and other training programs. He has also organized many training programs for faculties and students. We are very much happy and proud to have such a resource person for today's session. Thank you, sir, for accepting our invite.
Yes, thanks for kind introduction and kind invitation. The topic for today's expert lecture is big data for population health management. Now, I will just give a slight introduction about these basic concepts and then we go how this big data analytics is playing its presence or its significant role in various areas and particularly in healthcare or medical or in pharmaceutical industry. Now, these slides are moving now in your screen.
Sir, your screen is not shared.
1 minute, I'm sharing again. Now these are moving.
Yes, sir.
Slides are moving now.
Yes, sir.
Okay, thank you. Yes. Now this means what is healthcare data? Means healthcare data is any type of data which is related to healthy conditions or this disease related conditions or disease related symptoms, quality of life and health outcomes. This healthcare data can be produced by everything from wearable devices such as smartwatches to patient records and medical imaging technology. Nowadays, we are finding these smartwatches are means introduced in the market, and almost majority of you participants might be using these smartwatches. And these smartwatches are nearly doing the work of 30 to 40% work of any physician, our family physician. Means how what is our breathing means rate, air means lungs related data, then how our pulse is there, blood pressure is there, what is our oxygen level and what is our heartbeat and how many number of steps we have traveled or we have means walked and different parameters. These wearable watches are wearable, these devices are now introduced in terms of smart watches. Now glasses are also coming, smart glasses are coming. Means nearly 30 to 40% work of general physician work is done by these now electronic or latest IT applications of devices. Hence, these health data can be used to track the quality of care provided by healthcare systems, provide guidance for clinical decision making, and even track the risk factors that may be warning signs a patient could develop a particular medical condition, among other things. This health data provides benefits to patients, healthcare professionals, health facilities, and health systems. Then, what is big data analytics or big data? And particularly in healthcare. This big data in healthcare, it is technological challenge and is significant opportunity to revolutionize this how medical care is delivered, making it more personal, efficient, and effective. Because in India, we are not that much conscious or that much worried about the care, medical care, which doctors or physicians are prescribing or providing our medical hospitals, except big hospitals. Other thing, remaining thing, nearly we will find that just casual approach by these physicians and doctors is given to patients. And there is almost negligible quality of life or what we call quality of health services provided by doctors, except in some special cases, which are in that special cases which is very, very costly. And hence, every common man or a middle class person cannot afford that. Hence, we are not aware, we are not conscious about this quality of health life or quality of medical health provided. But in US and in developed countries, it is very, very rigorous. Hence, and cost of medicine or cost of this medical care in US and other developed countries is very, very huge, because they are all considering all these conditions and precautions as prescribed by HIPAA. It is one professional organization, just like we are having Indian Medical Council in our India. This HIPAA is that means taking care of these patients. This big data in healthcare refers to massive volume of data created by digitization of everything that gets measured and recorded in healthcare systems. These data, these details, these sources are coming, this information is coming from different sources, including electronic health records, medical imaging, genomic sequencing, payer records, pharmaceutical research, wearables. Nowadays, we are that much fortunate that at least we are having these facilities, those who can afford. And one thing is sure, those who are having good economic condition or good financial position, I am advising and requesting to all, even all our teachers, when we are able to afford this, please use these things. Means half of your medical work or half of your disease related remedies are possible with the help of these variables. These are so smart nowadays, and these are easily available in India. Hence, I am advising to my young or those who are means requiring some special medical help, and you are able, of course, in faculty in teaching we are able to means purchase that these variables. These are not that much costly, means we can afford indirectly, I'm telling. And these medical devices among others, then there are opportunities in big data for health care innovation. This AI and ML is used in diagnosis and treatment. These artificial intelligence and machine learning algorithms are trained on healthcare data, being used to interpret medical imaging, assist in diagnosis, and even predict the outcomes. This capability has the potential to provide faster, more accurate diagnosis and to assist the healthcare providers in making well-informed decisions. It is proved that the AI algorithms, AI softwares are so now becoming smart, so becoming reliable, that at least in three diseases, these in terms of cancer, in terms of heart attack, and in terms of Alzheimer disease, brain related, it is a memory related disease, Alzheimer disease. These are giving the exact prediction. You put that data in that software, and this will give the exact prediction when any particular patient or any person is likely to offer to be affected by these three diseases, or the this medical means disorders, indirectly what we call, but in general terms we call that diseases, because these are so fatal. These three diseases are so fatal ki it hardly gives any time to cover or come up from that if there is severe. Just like massive heart attack is there, even some doctors, I have read one news last year, one doctor from Rajkot, he has treated more than 16,000 patients. He was cardiologist, and he died out because of massive heart attack. Imagine the situation. Means we cannot actually. He was that much. Means when he is treating more than 16,000 patients, means he was also aware of this disease. Ki likely he is likely to be affected, but he anyhow he not means take cognizance of that symptoms, and hence he died because of this massive cardiac arrest. Even one of my friends, he was my colleague, and he was in Amravati, and moreover, he was also cardiologist. He also died because of this massive heart attack. Means he was treating the patients of cardiac and heart related disease, and he himself is dying because of this reason. Means why? Because we are not taking that much cognizance. We are taking our health, our disease as casual approach. This is the main drawback in Indian citizens. Majority of the our Indian citizens, those who are health conscious, they are taking all help. Actually, it is advised by doctors that when you are more than 45 years and above, you should have medical checkup once in 6 months. But we are not taking. We are going to clinics, we are going to hospitals only when the situation is very, very severe. And hence these even AI and MLs these tools, they are software, they are giving that predictions ki you are likely to suffer because of this and by what time you will be suffering this. Means these are so accurate predictions they are giving. Then real-time monitoring through variables. These variables are that's why I was advising you कि when we are able to accommodate these, we to purchase these, please use these because these will be used in case of emergency. I am telling you one this I have read one story in which CEO of one company has given his interview and given his thoughts. Ki one person he survived when he was drowning in sea, and he survived because of this wearable device. He has sent this SMS alerts to nearby this emergency centers, and because of these smart wearables, he was survived by the rescue team. And he, this CEO of that company was explaining how these wearables are saving the life of these drowning people. Means devices such as smartwatches, fitness trackers, and other wearables are capturing data on physical activity, heart rate, sleep patterns, and more. This real-time healthcare data can be used for early detection of potential health issue, enabling healthcare providers to intervene the sooner. I am telling why we are earning, why we are taking so much pain for prosperity. Yes, we are working for prosperity, and we are fortunate. We are teachers. At least we are in a higher middle class of the society. We are earning for this, for our families, for our generations. But I am advising, please take care of you first. If you are surviving, then only you will be able to take care of your this wives and sons and daughters or your family. If you are in trouble, then who will take care of you? Hence, wherever, whenever we are having that, and we can accommodate. I'm telling you, almost all teachers we can accommodate that. We can purchase. We are having that much income in 7th pay now, 8th pay is on the cards. Definitely, of course, this is slight expenditure is there, but we should take. I am telling you, no compromise on health issue. You take compromise on your clothes, on food, and on health. I don't advise to have any compromise on this. Take care of you. If you are healthy, then your whole family is healthy. If whole family is healthy, then whole country is healthy. And take care of this because students are following us. We are role model for society. And please take care of you. First you, then your family, then your students, then your country. Indirectly, it means contributing to our healthy nation, healthy and wealthy nation. Wealthy it will be coming as per economy. We are on the cards when we will be becoming this third largest economy. Our honorable PM sir is working on this. Our policies are working on this. FDI is also there. But first thing is we should take care of our own. We ourselves should take, and when these type of variables, these are types of these facilities are available, then why not we should purchase that? Telemedicine and remote patient monitoring. Nowadays, telemedicine, since Corona has provided, of course, the fruits of Corona were not that much good. Corona has given bitter experiences throughout the world. But one thing Corona has given good opportunity for us also. That is these telemedicine or IoT applications indirectly, I'm telling you. Ki when even during Corona, these medicines were prescribed by our physicians, our surgeons through telemedicine media, through online mode, Internet of Things mode, Internet of Medical Things mode. Hence, we should, and Corona has given this opportunity. Even nowadays, are attending this training program because of this IoT application. Actually, this is possible after Corona. Up till now, all these training programs were organized in class mode, and teachers were coming in your campus. All you were sitting in classroom, and these trainings were there. But now, because of this Corona, this has given means excellent opportunity for that. And now, since last 5 years, we have seen that IoT applications almost in all areas of our life. These they have proved their significance, and now even the one research is taken place, and in that the nearly 70% of students are now willing to attend the classes in online mode. throughout world. It is this research is coming, output is coming that way. Means the students are preferring now online lectures, even though they are paying these fees and all tuition fees and other fees of college in of offline modes. But beyond that, they require their lectures, their these classes as per their convenience. Hence, they are giving that freedom. Nowadays, even teachers are also means now we have become habitual of organizing these type of online training programs, online lectures. To this real time, this remote patient monitoring, it is giving this. Even though when we are in remote place, when we are away from home, and when there is no in surrounding area any medical facilities are in remote areas, rural areas, there are very less quality of life, or even these physicians are not available. But these smart variables are saving us. They are giving that inputs. This has become increasingly valuable in rural area patients with chronic conditions, enabling them to access high care without need for in-person visits. Because whatever, except in very very emergency and very just like a heavy massive cardiac arrest is there, then nobody will means rescue from that. But if it is mild attack or it is the symptom of that, at least our life can be protected. Then advanced research and drug development. Nowadays, this drug delivery, drug development, this is done with help of AI and machine learning softwares. This healthcare data science has opened new avenues for research by providing rich data set of clinical trials, drug discovery and development. This IBM Watson, this is the name of company, it is using big data to support cancer treatment by identifying promising treatment pathways. These machine learning models trained on patient data can predict how different populations will respond to treatment, speeding up the development of new medications. Because in up till now it is means experienced by studies ki the people who are suffering from cancer in initial stages, very limited number of patients are taking care, personal care, just like I was advocating. After 45 years, we should have our means medical checkup once in 6 months. This cancer disease is diagnosed when it is reaching at the third stage. Means where no any surgeon or any physician or any oncologist will be able to protect us or save us from that. Just he will prolong that disease. But once it is at the third stage, it means very, very fatal condition. Just we will be counting the days in that case. Hence, these ML software, these ML tools, they are giving that inputs for that. Hence, I was telling you these three diseases are giving or means identified as the most results. These predictions are given. AI and ML predictions are given in at least in cancer, in cardiac arrest or heart attack, and this Alzheimer's disease. Then these are various sources of healthcare data. That is electronic health records. These clinical data such as medical history, diagnosis, lab results, and treatment plans. Then claims data. So I'm taking the example of insurance companies. Majority of us are having on this insurance. So means medical insurance also. This medical insurance is done by general insurance companies, GIC companies. There are 4 GIC companies. They are doing this medical insurance for these families and for individuals also. From this data, we can collect that information from insurance claim that provides insights into cost patterns, resource utilization, and treatment efficacy. Then patient-generated health data. This real-time data from wearable devices, fitness trackers, and mobile apps are offering insights into patients' lifestyle and well-being. Then social determinants of health data. This non-medical data on socioeconomic status, environmental factors, and community conditions that significantly influence health outcomes. Then genomic and omics data. This comprehensive biological data and facilitates precision medicine and personalized data treatment. There was one news in news channels, in WhatsApp groups, कि the personal information of central government officials have been given to or provided to Chinese companies. 3 weeks before I read this news. Means actually your personal data cannot be made public. If in India we are least, that's why I was telling you, we are very least worried about our personal information or secret information in India. But in US and developed countries, it is offense. You can claim that why your personal data was leaked or why this was provided without your consent to other competitors or any commercial organization. If it is for social, it is for general cause, non-profit cause, then it can be okay. But if it is for profit-making purpose, just like these companies, mobile companies and other consumer products companies, they are using that data, and because of that data, you and me are getting daily calls from either builders, either from insurance or from any other service providers. Imagine how they are knowing our mobile numbers or emails. It is because of that our data has been leaked. This has been provided without our consent. But in US and developed countries, it is offense. You can claim that why my data was leaked or provided to that person, commercial person. Then these are key applications of big data analytics, that is predictive risk modeling. Using these algorithms to forecast health risks such as hospital readmissions or disease progression and identify at-risk patients before issue become critical. Then patient segmentation. These grouping individuals with similar health needs of risk factors. Then real-time monitoring. Continuous data collection from wearable device to track patient vitals and trigger early interventions. Then disease surveillance. This tracking and predicting the disease outbreaks by analyzing large data sets, enabling more productive public health responses and operational optimization, using data to improve hospital operations, including streamlining administrative tasks, optimizing staffing, and forecasting the resource needs. These are different benefits of big data analytics in public health management. That is improved patient outcomes, means early detection and personalized care plans lead to more effective treatment and better overall health for individuals. Nowadays, precise medicine is concept is coming. Precise means specific to particular person, not for general purpose or general persons. Means which I was telling you, just like say our celebrities, they are having these precise medicine facilities. Take example of one or two hospitals. I am giving the names of that. Means this is Breach Candy Hospital in Mumbai. In Mumbai, this Breach Candy Hospital is there. Another is Dhirubhai Ambani Medical Hospital, Dhirubhai Ambani Hospital. It is in Andheri. These two hospitals are so popular for that it means all celebrities and all politicians, all VIPs, they are taking treatment in these hospitals only, in these two. In Mumbai, particularly in Mumbai, I'm telling you. Because medical facilities in Mumbai are the best. Of course, in Chennai, these are goods, Bangalore are goods, Hyderabad are goods, Delhi are goods. But these are only in selected cities. But in Mumbai, throughout India, it is the best. These two, three hospitals are so popular. And because of their means precise treatment or precise medicine provided, of course, their cost is very, very high. You and me cannot afford that. But since celebrities and VIPs and other political parties, they are able to sustain that, able to pay that. Hence, they are taking this treatment, and because of this, at least they are getting their health, means better health facilities, and at least they are means upcoming from that disease earlier and with comfortable condition. This is the effect of this precise medicine. Even when we are going to any specialized doctors or specialized hospitals, then at least at that point we feel comfortable. At least we have come to right place. The same is here. Means improve with the help of this big data analytics, then enhance operational efficiency. By analyzing data, these healthcare organizations can streamline workflows, reduce waste, and allocate resources more effectively, leading to cost savings. Then shift from reactive to proactive care. Means analytics enables the transition from treating problems after they occur to prevent them from happening in the first place. Particularly for chronic disease, just like I was telling you, these three diseases, at least in cancer. If any of slight simple or these symptoms are there, at least we can take precautions. These data means these predictions are coming with the help of this big data analytics and other details. At least we can take that precaution, means we can survive from that deadly disease. Because cancer is its roots are so increasing, its virus is so increasing fast, it doesn't give time to means control come or control in when it is in third stage. It is very difficult to control. Then addressing these health inquiries means analyzing this HDS data can reveal respiratory in care, and public health officials can design targeted intervention to reduce them. Then these are benefits of adopting big data in hospital healthcare. It is more efficient operations are there, support for medical research, risk and fraud detection. It is also one of these benefit in which nowadays some fraud cases are coming because of this wrong medical means insurance claims, or some persons are there taking wrong medical certificates for some other misuse. So this fraud detection is possible with the help of this big data. Then enhance clinical decision making and population health management, faster diagnosis, treatment, and improved patient outcomes. Because we have seen that patient is when if any person is becoming ill, imagine his mental condition, his physical condition, imagine whole family is disturbed. At that time, he or she requires only survival. But when we are aware, when we are coming in the last stage, means where the efforts for physicians and doctors are, means they have to take very severe efforts. Hence, we should take, at least we are educated, we are health conscious, at least all teachers, because uh, the general society consider us as the role model, and at least we should take our health precaution of our health, even if, of course, since our body, every human being is becoming ill. Nobody is perfect in this world. Some are becoming having that good immunity power, which we have proved in Corona. Since our immunity power in Indian culture is so excellent, because of that, minimum deaths were there due to Corona as compared to Western countries. Because of our immunity power, since we are Indians are having that much immunity, hence we should take that our health first. Then these are different real life examples of big data for population health management. That is predicting analytics at risk populations. Mean analyzing these data, predictive models identify individuals at high risk for adverse health events. Means this is case Mount Sinai Health System used machine learning to analyze electronic health records and identify high risk heart rate failures. This proactive intervention have reduced the hospital readmission by 20%. Means because of this, at least 20% people were they were prevented because of this proactive intervention. Then this sepsis detection. This Johns Hopkins Hospital developed an AI-driven sepsis prediction model that analyzes patient data up to 48 hours before symptoms appear, significantly improving survival rates through earlier treatment. Then predicting admission. These predictive models evaluate the patient's medical history and other factors to identify those at high risk of hospitalization. Then chronic disease management. Here, this big data is used to create targeted programs for managing common and costly chronic disease like diabetes, cancer, and heart disease. Because this diabetes, I'm telling you, any person, those who are having this diabetes disease, on this there is one conception or wrong impression that diabetes cannot be cured. I'm telling you, diabetes can be controlled, but this requires day-to-day systematic treatment plus our life standard, means day to day our life culture, our day to day our work related activities. We to take that prevention. It is not because of sugar, I'm telling you. Majority are having this exception, or this any impression ki it is because of sugar or sweet. Of course it is increasing with this, but it is not the only reason. It is because since our physical activities we have restricted, and we are consuming more calories, and this is occurring more, or it is means, of course, this diabetes is means it is deadly disease. It is silent killer. But I'm telling you, this can be controlled easily. It can also be cured with the help of natural medicines, natural habits, yogas. For that, we have to take more precautions. And this with cancer and heart disease, which I was telling you, these AI algorithms are giving these at least in three. These are giving perfect predictions. Then this diabetic management, this popular health platform has been used to manage asthma by prescribing digital sensors with medication. For diabetic patients, these continuous glucose monitors are used to use data to provide real-time analytics, enabling timely adjustment to treatment plans. Then cancer research. These companies like Tempus and Flaretron Health, they are building comprehensive database of clinical and genomic data from cancer patients. These helps researchers identify optimal treatment. And all these hospitals which we are taking these, almost 90% of these hospitals are from US. You might be showing, sir, why I have taken these examples from US. I'm telling one reason. Because in US, this health consciousness or health awareness is very, very more. Because US is just like heaven. Every person's dream is to visit US. Every person's dream is to settle in US. And in US, the cost of medicine, cost of health is at optimum level, highest cost throughout world. People are ready to pay the charges, the fees. They want comfort, they want the quality of life. Hence, majority of these new development, just like big data analytics, these are used AI and ML. These are used in these advanced countries in US because they are ready to pay their charges. Then community risk mapping. This University of Florida is using public health data and Google Maps to create heat maps showing population growth and chronic disease prevalence. This helps with strategic planning for allocating medical service where they are most needed. Then disease surveillance and outbreak control. This timely data analysis helps public health agencies monitor and respond to health threats. Of course, this when COVID was in the earlier stages in March 2020 when COVID was spreading throughout the world. Nearly 197 countries were suffered because of this. And this was the mischief of China. China spread this COVID disease and China was doing "Okay, what is the remedy for that. And since this in the initial when 6 months during this March 2020 to September 20 in India, we have seen these lockdown periods. During this lockdown, our classes were closed. We have not visited our campus in our college. From home, we have taken this submission in lectures and examinations also. And result is also declared on online. Everything was online during these 6 months. Why it was there? Because at that time nobody was knowing what is the remedy for this. Because this at that time medicine was not available and people were also means doing this trial and error method. Which medicines will be there? During I'm telling you with Delhi people, and Delhi was the hardest hit during COVID after Mumbai and Bangalore. The reason for Delhi to be affected are number of more patients during this COVID in these metro cities was because Delhi is the highest air pollution. Nowadays we are seeing that data of Delhi air pollution, and this COVID is means was attacking to those people which were having asthma related or lungs related problems. And air pollution was also related with this asthma related or our lungs or respiratory problems. And hence COVID means attack these people. And the cost of this treatment in Delhi in the initial this March to September 2020, it was nearly 16,000 for treatment of this COVID. Those who were able to pay that, they have paid 16 lakh, 1/6 lakh. And now you see that COVID medicine, it is coming hardly at a 500 rupees, even below that. Imagine the situation when it was totally new, nobody was knowing what is the remedy for that. People were only demanding, I want to survive. Whatever cost you are taking, take that. Protect me from that. This was the situation because nobody was knowing what is the remedy for that, what is the precaution for that. And people paid 16 lakh rupees. Now it is coming hardly 300-400 rupees. That same medicine. Even we have exported this medicine to US and other developed countries. Covaxin and other. Then this COVID-19 tracking was also possible with the help of this. This big data was instrumental in tracking the spread of this virus, monitoring infection rates, and predicting resource needs such as hospital beds and ventilators. Because even these during these ventilators and other oxygen-related and medicines were utilized and delivered by drones at that time. Means drone help in that when coronavirus at its peak. Because when lockdown was there, no any traffic was means no vehicles were permitted to ply on the roads, and only these medical purpose the drones were utilized for that. Then early outbreak detection. Researchers can analyze vast data sets, including social media posts. Nowadays, we are having WhatsApp group. This is the most effective or influential of these apps nowadays, WhatsApp and other social media platforms. These unlinked search queries to identify early signs of infection disease outbreaks. In social determinants of health. These early focus care, integrating these social determinants of health such as access to food, housing, and transportation with clinical records can identify health inequalities. Payers and providers can use this information to design targeted and improve outcomes for high-risk populations. Extraction from clinical notes. This natural NLP means it is the natural language processing. It is the form of AI and ML. It is used to extract unstructured SDO data from clinical notes within electronic health records, such as mentions of housing insecurity or financial difficulties, to get fuller picture of patient's circumstances. Genomics and precise medicine. This personalized oncology means it is related with cancer disease. In precision oncology, big data allows physicians to analyze the genetic makeup of patients' tumor and select targeted therapies with high chance of success. Then drug response prediction. By analyzing these generic data, clinicians can predict how individuals will respond to certain medications, allowing for personalized prescribing and minimum adverse reaction. These are different big data in healthcare applications, just like in cancer research, disease detection, population health, pharmaceutical research and development, and health insurance risk assessment. Because insurance companies, they are also utilizing this data. And I'm telling you, artificial intelligence, machine learning, these are the highest paying job. Those persons who are knowing the skills or software and tools of AI and ML, they are the highest paid today. Companies are paying them 100 crore rupees per year. After that, third big area is big data analytics. Means imagine what is the importance of big data analytics in all areas. Means it is so vast the potential it is having in job prospects. First is AI and ML, and second it is coming big data. Means it is having so huge potential for salary. These are different big data analytics in healthcare, in which we are finding this electronic health records, genomic sequencing, remote monitoring, particularly. Then big data and cancer research. These researchers in both private and public sector are dedicated to everything from searching a cure for finding more effective treatment options. Big data has changed the way these researchers understand the disease, provide access to patient information, trends, and patterns, which was previously not available, not accessible. But now with the help of this big data, we can means have that options, and we can save and protect the life of these patients, cancer patients. Then these are different companies using big data to make headway in fighting cancer. 8 to 10 companies are there, and almost 90% of these companies are in US. This is GSX location. It is Louisville, Colorado. This aims to improve patient care and connect healthcare organizations to suppliers through its supply chain automation tech. It provides clients companies with electronic payment solutions, vendor credential, supply chain consulting, and data management tools. The company includes military hospitals, defense logistics, and defense health agency. Means it is majority its clients are from defense sites. Then Tempus AI. This is in Chicago, Illinois. This is building the largest library of molecular and clinical data in world with goal of providing medical professionals. This platform collects and organizes data from lab reports, clinical notes, radiology scans, and pathology images, accelerating oncology research and helping physicians make more personalized and informed treatment plans. This Flatiron Health. This is in New York. This company uses billions of data points from cancer patients to enhance research and gain new insights for patient care. These solutions connect all players in treatment of cancer, from oncologists and hospitals to academicians and life science researchers, enabling them to learn from each patient. I'm telling you, these hospital or medical related fields, these are highly valued in US. The reason for this, I am just giving you one hint. You will be realizing and you will be accepting this fact also. When Mr. Donald Trump, President of US, since last 3 months, he is behind US universities. He is restricting that universities not to enter, not to give admission to other countries' students in US. He has taken different protective or prohibitive measures. The latest one was the trade which he has imposed trade highest tariff against India and China. Or if you want to visit US and settle in that, you have to pay 1 lakh rupees as the visa charges. 1 lakh dollar means 84 lakh rupees per visa. Imagine. With one exemption, he has exempted these doctors, medical professionals. Means if medical professionals are visiting US, then no fees per visa. Hence, I was telling you this hospital industry or medical or healthcare professionals are highly valued in US. But only quality physicians are those who are not compromising, just like these doctors in Breach Candy Hospital and Dhirubhai Ambani hospitals. Such type of doctors and these medical physicians or medical professionals are daring to enter in US market because there no any compromise and take it granted concept is accepted there in US. Because if anything goes wrong, then that doctor has to pay that in compensation, and it is very very huge. Their laws, their rules are very very rigorous. This Oncora Medical, it is in Philadelphia, Pennsylvania. This Oncora Medical is simplifying workflows for oncologists by blending this machine learning, automation, and big data into single platform. With these company data analysis tools, oncologists can compare data and quickly add information to patients' health records. These oncologists can review the patient's radiology and pathology history faster, delivering more timely and personalized care to cancer patients. Then big data and early disease detection. This is one company that is Pieces. It is in Texas. This is cloud-based software company that collects data throughout the entire patient journey to improve both the quality and cost of care. The company's flagship product, that is Pieces Decision Sciences. It is a clinical engine that makes decisions and recommendations based on variety of data such as lab results, vitals, and structured and unstructured data. This platform consistently works to identify possible interventions. Then Para Health, the Rothmox Index, is name of that company. It is in North Carolina. This is the creator of Rothmox Index, that is peer-reviewed universal scoring system for overall health of a patient. Just like we are having CIBIL score in terms of banks, same is that Rothman Index. This score takes the data within electronic health records, vitals, lab results, and nursing assistants to assign a score. These scores are provided with the visual graph and updated in real time to identify changes and keep track of details. Then Prognos location, it is in New York. This Prognos, it applies artificial intelligence to clinically data and manage the Prognos factor. It is hub for multi-source diagnostic data. This AI platform helps physicians apply treatments earlier, displays clinical trial opportunities, suggests therapy conditions, and expose care gaps for more than 30 conditions. Then big data and population health. These companies are there. Nearly 40 to 45 companies, they are offering their services in different means specialization and different avenues. Then Strive Health, it is in Denver, Colorado. This Strive Health offers technology and services to innovate care for patients with chronic kidney disease. In nephrology, what we call that indirectly. This nephrology is related with kidney disease. In the area of population health, the company provides its partners throughout the healthcare system with access to care multiplier platform and displays care teams with the goal of enabling new standard of kidney care. This Strivel's care multiplier technology gathers data from multiple sources and use machine learning to power predictive analytic models that produce data insight to fuel optimized personal care. Then One Up Health, it is in Boston, Massachusetts. This offers data solutions to enable interoperability across the healthcare ecosystem. This company's One Up Population Connect product simplifies acquisition and sharing of clinical and claims data to reduce manual work. Then Arcadia, it is totally online, fully remote. Its big data platform provides organizations throughout the healthcare and landscape with actionable insights that enable them to make more strategic decisions. Then Emitech Solutions, it is in Missouri. This applies data to the health field in multiple ways, from modern data management to healthcare analytics. And this Emitech utilize data for population health management, combining physical and behavioral health data. Should I share one video with you?
Pardon, sir?
Yes, I'm sharing one video.
Hello, everybody.
But it's not visible, sir. Only your previous slide is being shown.
My name is Garrett Schmidt.
Can you please play your video, sir?
Yes, I'm doing that.
I'd like to welcome you all to
Yes, it is playing. I'm sharing that video.
by Data Lake. And
I'm
it's
sharing
called
that with you.
Transforming
1
Care
minute.
Management with AI. It's risk stratification and predictive modeling for better health outcomes. A lot of interesting things we're going to be discussing today.
Now it is displayed on your screens, this video.
Everyone has joined today.
Yes, sir. But volume is low.
Its audio original is very less volume is there from the original.
That has been done
Oh,
for you.
okay.
So all you have to do is listen, but we do want to hear from you. We're going to have some time today towards the end of the presentation.
Helping us move forward with a more proactive, data-driven, and patient-centric outlook. I look forward to this engaging discussion on how we are collectively harnessing, how we can collectively harness this technologies and address some industries.
This video is displayed on your screen, no?
So, while I'm talking about challenges,
Yes, sir. Visible.
Okay, yes, please, yes.
Let me just talk a bit about the kind of challenges I'm addressing out here. The kind of pressures that healthcare industry is experiencing from the rising cost, workforce shortages, as well as the inefficiencies in resource utilization. These challenges are not new, but these are, and also not just operational, but even directly impacting patient health and
Results are in now, so I'm going to go ahead and close it down.
used for payment mechanism, for care coordination, for financial planning, and so on and so forth. So the purpose of the defining that should be at the level of complexity. However, when what we are talking about, either we are looking at a members holistic saying a generalized risk model that would differentiate and classify members into different groups.
Thanks, Saurabh. Yeah. So we've seen there are several ways in which risk scoring can be done. There are several different use cases, and in general, it has been found that states only considers 4 features, but I know
on just the first parameter, which is the average cost per member. So the average cost per member in the low category for the AI model is $439, which is way far away from the high category, which is $31K. Now this separation reduces in the risk model. If you see the low category, the average cost per member is around $2,000, and in the high category it is around $22,000. And you will find the same insights across all the different parameters that we have shown in this. One subgroup where the ER expense had gone by almost 100%, and the other subgroup where it had gone by around 120%. Now that's not it. I mean, the cohort builder, the machine learning based cohort builder, not just stops at that, it also gives you the main reasons. The main reasons for the first category was the statin non-adherence, and the second category was severe heart problems. There were other reasons as well. These are the top reasons. So
Yes, I'm trying to share open another video to see in which voice is completely more. And
Okay, sir. Okay.
I'm trying to open that, please.
Think of the largest hotel chain in the world today. Airbnb doesn't own a single hotel. The biggest medical systems in the future are going to own no hospitals. It's going to be devices that are monitoring the lives of millions of patients simultaneously. So if you want to think about the future of medicine and what that entails, think today about the largest car company in the world. Uber doesn't own a single car. Think of the largest hotel chain in the world today. Airbnb doesn't own a single hotel. The biggest medical systems in the future are going to own no hospitals. It's going to be devices that are monitoring the lives of millions of patients simultaneously, that's looking to see if you have the beginning signs of the cancer emerging, to not treat the cancer, but to prevent the cancer from ever occurring. Like that day is definitely coming. My name is Dr. Eric Schacht. I'm director of the Icahn Institute at the Mount Sinai Health System in New York. Please call me Eric. I'm not a real doctor.
No, that video is not opening. It will be going to restart mode, hence I am avoiding that. We go with this or PPTs.
Think of the largest hotel chain in the world today. Airbnb doesn't own a single hotel. The biggest medical system in the future.
Yes, I'm sharing our PPTs and I will try if video is operating, then I will share that. Otherwise, we continue with this. Now, this is Linguamatics. It is in Massachusetts. This collects untrapped, unstructured data in electronic health records for research and solutions in population health. By using this NLP, these linguists use unstructured patient data to identify lifestyle factors, build predictive models, and detect the high-risk patients. Then socially determined, it is in Washington, D.C. This company takes the more holistic approach to population health by supplying healthcare organizations with social risk intelligence. This company's platform is Social Escape. It measures factors such as patients' access to housing, transportation, and food. These healthcare groups can then craft their strategies around these variables to deliver tailored care to specific populations. Because when any patient is becoming ill, whenever we are visiting and going to doctor for means taking medication and other diagnosis, he takes first whole history. What were symptoms, what is our nature of duties, what we are doing, our day lifestyle. He is asking that questions. Why? Because he is able to link that symptoms with our lifestyle and other symptoms. The same these factors, these parameters are means taken care by this platform Social Escape. These patients which I am means we have written here, that is housing, transportation, and foods. Means, these, at least in food, majority of our diseases are related with food, with stomach. Nearly 50% of diseases are related with our food habits. Hence, he is taking that. This company's platform is means taking that data also. Then big data and pharmaceutical research. These companies, pharmaceutical companies, whether these are vaccines or synthetic insulin or simple antihistamines medicines produced by pharmaceutical industry play important role in treatment of disease. Now, this new drug discovery and creation depends on data to assess the viability and effectiveness of treatments. These companies are using this big data to help enhance pharmaceutical compliance with research and development. This is Evidation. It is in California. This is mobile app that rewards users for healthy behaviors, provides access to health insights, and offers opportunities to contribute to health research. Through Evidation, these researchers can access everyday health data that informs their work and enables them to discover new ways of diagnosis, treating, and managing various medical conditions. Then Equia, this is in Durham, North Carolina. This company or platform builds links between analytics, data, and technology so pharmacy leaders can complete faster and more effective clinical research. Because up till now, we have seen that before the introduction of AI and ML, these pharmacists, whenever any new drug is to be introduced in the market, it is not directly imposed or directly given to human. It is first given to mouse and monkeys. These monkeys are given because the DNA of human and monkeys is almost similar, considering this near more than 5,000 years old history, in which now in these taking trials on these monkeys and mouse or rats, it is time consuming. And hence, with the help of this AI and ML software, at least this drug discovery and drug delivery is now becoming comparatively more easier with accurate results. Because these AI and ML software, these pinpoint the ideal patients for specific trials. Pharmacists can then run decentralized trials, compile data with the various device, and jumpstart the research and development process. Then Calderos, it is in Chicago, Illinois. It is challenging the cost of pharmaceutical through drug discount management platform, which collects data from multiple sources and stakeholders to improve transparency among patients. These drug manufacturers, covered entities, and players can use this platform to collaborate too. Even we have seen that the cost of medicine is comparatively more, and hence our honorable PMs are also means is always stressing. Now these generic products we can means doctors now can in US. I am telling you the doctors are not recommending the name of the company. They are recommending the name of the product means name of component or the contents. And according to that, physicians, pharmacists, they give that composition medicine to you. Suppose you are becoming ill, and in India we are taking that either crocin, either compost, either different more than 500 brands are there for fever. And doctors are writing the name of that product in India, but in US they are not writing the name of product. They are writing the component composition of that drug. And physicists or pharmacists, they then give you the according to that. Even the nurses in US, they are better than our doctors, especially doctor in India. They are so experts, nurses in US, in developed countries. They are so means skilled this in their means day-to-day working. This Cloudera, it is in California. This Hortonworks data platform continues to help pharmaceutical companies and researchers gain better view of pharmaceutical data. Then Innoplex, it is in New Jersey, US office. So you will be finding nearly 90%, more than 90% of these companies are in US. The reason I have told you, these companies, they are having their potential in US because paying capacity of patient or consumer is comparatively good. as compared to Indians are throughout other parts of world. Because this there is so huge income in US. Everybody means just like it is heaven on the earth. Every person's dream is to visit the US or settle in US. It is so luxurious and more comfortable life in US. With these platforms, these tools use and give inputs to pharmaceutical companies by relevant information needed for research and new drug delivery. This data is collected through millions of publications, articles, dissertations, thousands of clinical trials, drug profiles, and congress articles, means conference articles indirectly, what we call that. Then e-clinical solutions, it is in Massachusetts. These clinical research programs rely on e-clinical solutions. The more than 100 organizations across the life sciences landscape rely on these company solutions. Means it is having that much reliability in US. This company offers platform that unifies data from disparate sources and delivers real-time insights. Then big data and health records. This is fourth area where we are finding this big data. When it comes to healthcare and especially health insurance, risk is often a large contributing factor. This Blue Byte, this is fully remote company. It is designed to help surgical facilities and clinical practice compile and exchange data efficiently and securely. This data color includes appointment schedules and procedure codes and equipment inventory. Then Avenir Health, it is in Illinois, Chicago. This works to improve the efficiency of data in the healthcare industry by giving network participants access to administrative health. This was founded in 2020, only 5 years back. This is the top healthcare industry, including this. These are names of that company: CVS, Anthem, Cleveland Clinic, and more. But since these company Avenir have made its reputation within 5 years, which company's platform relies on blockchain. Then Particle Health, it is fully remote. This makes an API platform that brings together patient records. Then Upfront Healthcare, it is in Chicago, Illinois. This platform, its company's Upfront Healthcare software platform, use data-driven personalization to improve communications between healthcare and patients. Then Human API, it is fully remote. This streamlines the underwriting process by allowing teams to sift through detailed electronic health records. Then Epixio location, it is in California. This acquisition technology wrangles medical data from millions of files, claims, and PDFs and other health data. With this information, Epic's coding application provides accurate risk adjustment for healthcare providers. Then Health Fidelity, it is in San Mateo in California. This helps healthcare providers and institutes to find risks normally considered in clinical charts. This company uses NLP, natural language processing, to extract 100% data within clinical charts and identify problems in care assessment and documentation. Then Garner Health, it is in New York. This conducts analysis of millions of patient records and million medical claims. Then Optimize Health, it is in Seattle, Washington. This company platform offers remote care platform that serves as a unified interface that allows medical providers to comprehensively view patient data. Other big data in healthcare applications. This Alias, it is in Chicago. This Medtelligent, it is platform or software that use the suite of software nodes, also known as Alias, that support efficient management of assisted living communities. Then InterSystems, it is in Boston. It offers Iris for health platform engineer to help healthcare organizations. Then Find Health, it is in Texas. This aims to help build a more effective and comprehensive system of care. Then Patient Point, it is in Cincinnati, Ohio. This develops technology to enhance healthcare experiences. The company aggregates and analyzes data, different providers' behavior, patient demographics, clinical touchpoints, and campaign engagement. Then it is the potential or market big data in healthcare. It is statistics are trends and overall markets. The how it is affecting or what is its potential. It is growing at compounded average growth of 19%. Means it is significant growth as compared to 2020, and during its means by next 10 years its progress is nearly 19% growth. It is projected to reach $105.73 billion by next 6 years. US saves 300 billion annually using big data analytics. Clinical analytics project to reach this 11.35 billion by this year. By this, from 2024 to 2033, big data in financial analytics is projected to have 21.1%. Means in this specific area, it is financial analytics, it is more. Use of machine learning is expected to grow by 10.6% in hospitals and clinics. North America dominates the big data, which I was telling you. It is having 34.7% revenue. And big data storage in healthcare industry will reach 175 zettabytes. Means zettabyte is equal to 1 billion terabytes or 1 trillion gigabytes. Imagine how much this data will be there, 175 zettabytes. These are different factors influencing these demands or this progress, this growth. That is patient management, disease tracking, quality decision making, medicine tracking, healthcare efficiency, financial management, data visualization, and securing patient data. Amazon has dominated the market with $1.77 trillion. Different service providers are companies in global big data analytics are Amazon Web Services, AWS, Google, International, IBM, Looker Data Incorporation, Mu Sigma, Oracle, SAP, SAP, Siemens, Tableau Software, ThoughtSpot Incorporation, Joe Corporation. These are this healthcare technology global market report means how it is going. Means it is healthcare technology. Its compounded average growth is 20.6%. It is from last year it was $507.25 billion. This year it is expected $592.49 billion. And progress it is going to $1 to $5.38 billion by next 4 years. These are use cases of big data in healthcare. Means in real-time care, fraud detection and risk management, drug discovery and research, population health and management, remote monitoring, precision medicine, hospital operations optimization, personalized treatment, and predictive healthcare. These are predictive healthcare for specific conditions. In which this Mount Sinai health system, these are using these capability to proactively manage chronic disease. Personalized treatment plans that like IBM Watson is using for oncology. This hospital's operations optimization. This John Hopkins Hospital is using these electronic records of patients so that waiting time and improved patient throughput is possible. Then precise medicine and advanced research. This Tempus name of that company, it is using clinical and genomic data to guide oncologists towards highly targeted intervention driven driving better outcomes in cancer care. Then remote monitoring this Kesmer Performance, it is company which has successfully integrated remote monitoring into chronic care disease. Then fraud detection and risk management. This unified health group, they have applied these capabilities at scale using this modeling to reduce financial waste and improve the accuracy of claim processing. Then drug discovery and development. Pfizer, it is very famous company in India. Its products we are using. This is very famous and popular company in India. Pfizer. It is most reliable company. In research and development, these company like Pfizer leverage this big data and machine learning to accelerate drug discovery. Then population health management. In this Northville Health, this use big data to monitor public health trends, manage chronic disease. Then these are big data for healthcare operations. These are some challenges also. Since technology is new, hence data privacy is one of the challenge. Compliance with that standards is one of these challenge. HIPAA, it is more rigorous in US, just like we are having Indian Medical Council. Same HIPAA is more powerful in US. Its regulations, it is very tough and difficult for companies to have compliance with this HIPAA compliance. Then data standardization, interoperability, real-time demand forecasting, and data storage. These are some of the challenges. Then this is US advanced analytics market. Okay, how these are different Means 5 different analysis is there, in which first one is big data analytics, second is business analytics, customer analytics, risk analytics, the statistical analysis, and sixth is others. And this data is from 2020 to by 2030. This data is showing. Of course, this is the US advanced analytics market. So these are healthcare data use examples in which predictions and scheduling, then personnel management, learning and development, always indicates learning and development it is there. Electronic health records. This is this market. So this US electronic health records market. Here it is hospital use EHR and here ambulatory use EHR. Then patient engagement, then telemedicine, just like we have used this telemedicine, teleprescription in during COVID time. So this is the North America telemedicine markets. In this telemedicine, different this specialization are this are there. That is teleradiology, telepsychiatry, telepathology, teledermatology, telecardiology, and others. Means, see these words we are probably you will be listening this for first time or reading this for first time because these are so specialized, highly specialized areas. Means at micro level or research, what we call that it is in that concept. Means teleradiology, then telepsychiatry, telepathology, teledermatology, and telecardiology. Means we imagine we are not familiar with these in India, but these are practiced in US. Then cloud computing and alerting, these platforms like Gluco and Omada Health, they are using cloud computing with big data in healthcare to provide help with diabetes track and health indicators. Then these predictive analytics. These Optum Labs, they have collected data points on more than 150 million people. While being HIPAA compliant, means it is one of these, if you are HIPAA compliant, this means you are perfect in US. Because its regulation is, clause are so heavy, rigid, and very tough clause. Then medical imaging, just like we are having the CT scan and MRI and X-ray. To here it are finding this its market size in US. It is nuclear imaging equipment, MRI equipment, ultrasound systems, computer tomography, and X-ray devices. These big data technologies like optical OCR, healthcare professional can convert images into readable data. Then prevent the human error. These reports indicate that it is the output of that one report. This means human error factor is responsible nearly $29 billion in losses. Means because of just negligence, it is costing. Means it is preventing that human error. And this report means by applying this big data analysis, they indicated 66% reduction in data errors when AI is used. Means these AI tools are reducing these 66% errors, human errors. Strategic planning, then healthcare, then supply chain management. Also, this means these big data analytics can save up to $9.9 million in supply chain cost. Then security and fraud prevention. So it is these are different. This research is they one of researchers they have done this analysis and I have taken that data how it is significant in this big data and public health records, public health management in US. Then emergency rooms visits, then data prescription. Here it is. These are this medication incident type means how this wrong medicine or what we call that drug prescription has resulted in these patient outcome. Imagine these are the parameters. Wrong dose are restrained frequently, omitted medicine, then wrong drug and medicine, and here mismatch between patient and medicine. Wrong transport, omitted medicine, and patient allergic to treatment. Hence, I was telling you that precise medicine means suppose there are 500 drugs available or products are available in the market, it is not essential that all 500 these drugs are suited to all persons. Means some persons can be allergic to particular disease or particular medical medicine or any injection or any capsule or any these tablets. So it is means nearly 3% it is coming. Then wrong storage means they have not taken cognizance of this storage, because in medicine we have seen that some of the medicines we have to keep in fridge, cold storage. Otherwise, its properties are lost. Even when drug of these cup syrups we are using, these cup syrups we cannot keep in direct in touch with, means are in exposure to sunlight or daylight or our tube light. These, if you read that prescriptions or this advisory on this cup syrup label, it is written there ki you have to keep that in dark, cool place. They are writing this one word: keep in or store in dark, cool place. Means no exposure to sun rays or light, and means so at least in a cool condition means nearly if we not because not all medicines we can keep in cold storage or in a refrigerator, but at least we can prevent that from heat, because during summer in India we are facing this severe heat. During that time we have to take special prevention for this, otherwise its use or its properties will be lost. So hence all this, even wrong omitted past the expiry date, means some of these medicines they were served to patients which were having expiry dates. And these are also means they have taken this research ki how it is affecting that. Means all these are coming through big data analytics. Then this World Research Cancer found statement that there are 118 million cancer cases worldwide. And even Cancer Moonshot program, it was there. This opioid, it is one of the most pressing issue in healthcare in US. Thousands of people perish due to this problem, opioid. This year, this US healthcare data breaches in past 12 months. Imagine, ki of course, this is last report data. But during this 1999 to 2020, with these are number of these cases, ki how these healthcare professionals, they means data breaches in the last 12 months have occurred. Then suicide, it is one of these factors similar to this opioid crisis. Big data analytics can help with suicide prevention. These are the cases they have done that analysis. Then this future of AI in population health, because these advanced prediction models will be used, enhanced telemedicine is used, explainable AI are used in that, integrated care ecosystems are now used. These are different popular examples of big data in healthcare, that is predictive analytics. Then role of big data, then clinical. I am going now in last slide, since up to what time I have to continue, madam? 9:30. Yes,
Yes,
got
sir. You can continue, sir.
up to 9:30, na?
Actually, up to 9,
Yes,
but we started a little bit later, sir.
yes,
So
I was 10 minutes delayed. No problem.
you can continue, sir.
We can go as per the choice of your participants. If they are means comfortable with listening or attending,
No,
then I will
sir,
continue.
you can.
No problem.
Actually, the session is very interesting, sir. They can learn
Yes,
about.
sir. You have
I will cover
collected.
the last 2-3 slides which are important. Then we have question answer.
They
Yes,
are
sir. You can go as per your preparation, sir. No
Okay,
issue,
okay. No,
please.
from my side, no problem. I can continue.
participants also giving a positive response, sir. You can.
Okay, okay, very nice. Means we are having good participant, patients, listeners, and I was saying these are good teachers. So I should assume that.
Thank you, sir.
Yes. And drug discovery and development, then these are, then remote patient monitoring. These are different areas in which now how these are used in that. Even this variable device and remote monitoring also. Means here this is all this comes under population health management, general public health management, what we call that. In India, we are having this civil hospitals concept. The same is there. It is means for general public, what we call that. Here it is, name is here in technical terms in medical terminal, they have written this population health management. Means at large scale population. In India, we are having these civil hospitals or general hospitals, means which are government hospital, government owned hospitals. Means these are for general people, all people. These are some of the modern challenges of healthcare big data. First one is the HIPAA compliance. Of course, this is related with the US. This HIPAA is Health Insurance Portability and Accountability Act. It is in US, which I was telling you, we are having Indian Medical Council in India. In HIPAA, since it is this majority of these terminology or these cases are in US, since they are, and it is the throughout world, it is the toughest. One minute, I'm coming to that. I'm coming to that because it I have come one additional. To this HIPAA compliance, this is Health Insurance Portability and Accountability Act, means this is the toughest complaint in the world. And this big data for healthcare has to be compliant with HIPAA to protect personal information against data breach, which I was telling you. Here they have to take that much precaution that your personal, anybody's personal data cannot be exposed to any person except for either for government agencies or for non-profit organization for research purpose, not for profit organizations. Then another challenge is latest challenge which they are having, protecting patient information. Means this healthcare organization need a holistic data protection strategy involving cyber security measures and staff training on data protection. Cloud is one way that help protect, which I was telling you. There was one news which I read in news channels and this WhatsApp group. 3 weeks before, I read that major means all central government employees' personal data has been passed to China. Same is here. We have to take that much prevention, that much precautions, and data protection involving cyber security measures. Even now, new developments you might have read in that news channels or reports. Electrical vehicles which have been manufactured in China and working more than 100 buses in England and UK, they are working, they are having this cyber security problem. Means China, which they have supplied these electrical vehicles to UK, these are facing this problem of cyber security. Means they have made that chips in that. Means we cannot means means neglect ki China's means either we call that nuisance value or we call that the most intelligent measures. In both way we can measure continue that ki whether China is playing mischief or China is becoming over smarter than other countries. It means China has developed so much mechanisms because when any cyber threat is there, the first name comes of China, then Malaysia, then Turkey. These 3-4 countries, they are so popular in that. Means they have these cyber criminals are more means trained in these countries. Then integration of data from various sources and standard of seamless data exchange. Then data privacy and security, which I was telling you, that is data integration, then data. Then one of the new factor that is skill gap in healthcare data center, data science. Because healthcare profession or medical field, what we call it in the Indian term, we call it medical medicine. Just like MBBS, we are calling that in branches engineering and medical medicine and this. These healthcare professionals, they are also means facing this problem of skill person, skill in all aspects, which I was telling you, the US nurses are more intelligent and more professional and more accurate as compared to our Indian MD doctors or MS doctors. These nurses, only BSc nursing, just like a nursing course is up 2 years in India, we are having this nursing after 12 standard. This nursing course is there for 2 years. These nurses in US means they are so skilled persons indirectly. I'm telling you, they are so reliable in that the patient is having full belief on them. They are means taking care of this and their diagnosis capacity. They are at par with doctors in US. So this skill gap is one of the challenge in big data analytics in health data science. Then this future of big data in healthcare is how this will be affected in future. What are different emerging areas, different emerging trends which will be affecting this trend of big data in healthcare. That is increased focus on data privacy and ethics. Means as the data uses grow, the need for robust privacy measures and ethical guidelines also increase. This includes not only patient consent but also transparent policies and data sharing and utilization. In US, if you want to share that, you have to take consent from that particular person. In India, we are not taking any such measures, but in US and developed countries, this is one of these. Means this will be now increasing. In India, it will this concept will be coming within 2 3 years. Then improved interoperability standards, just like these new frameworks and standards like fast healthcare interoperability resources are being developed to facilitate data sharing among healthcare systems, which will improve coordination of care and enrich the data sets. Then growth in healthcare data science education. These education institutes are addressing this demand for skilled professionals by offering specialized training programs. The training will help to bridge the gap between data science, healthcare, and empowering the future leaders. Yesterday, I have read one report about this foreign means US and developed countries students. Now, the students they are willing to take admission in courses where they will be finding placement. Another report I have read last week, the students throughout developed countries in US and other developed countries, they are now demanding, they are taking admission in just like industrial training institutes, ITIs. In India, we are having this ITI, Industrial Training Institutes. In this pattern, this is after 10th standard for 2 years course. Different streams are there, different trades are there. In that, these students, I am telling you one thing. No any ITI holder I have seen which is unemployable. All ITI holders pass out certificate holders, they are getting job. If not getting job, they are entrepreneurs. They are service providers and they are earning at par with teachers. They are only just like 2 years after 10th. Imagine. Now these students throughout world, the new trend is coming. Students are not taking admission in degree colleges which are producing only theory degree holders. Now students are taking admission where they will be developing their skills. Indirectly, I'm telling that. Now students are becoming so intelligent and so means aware, awakened. They are now taking admissions where they will be finding their potential, their scope, their future in getting job or at least developing their skills, just like IT holders. Means these two new emerging areas are now arising throughout world. And hence, Mr. US President Donald Trump, he is advocating these two foreign universities in US universities. He is advocating कि you are producing these theoretical graduates. Don't produce this theoretical. Produce that graduates, engineers which are having some vision, having some skill, so that they can think about the country. Since our age old, when we have, when by last date, when our memory recalls us, we have learned that we read that US is the number one country in all aspects. Same US president want to continue in this, considering this progress of China in technological revolution in other aspects. If this speed of China is going on, probably China will be becoming technological leader within 2 years. China will be superseding US, and hence US president is worrying this, and he is advocating. Of course, now since last 1 week, he is now having some favorable condition for Indian students. For India now, his impression is going on in favorable because the skilled people, this think tank or this member of parliament, because in US these professionals are these thinkers, what we call that, their voice is heard by US president and in all other avenues, and they have advocated for them in favor of India, and they have advocated and they have convinced Mr. US president कि if you neglect Indian skilled persons, then US is losing its presence. US is losing its status. Its economy is now disturbed because they have neglected our Indians. I am telling you, nearly 40% of the foreign nationals who are working in India, out of that 40% are from India only. Means imagine, 40% of these persons, those who are working in professionals, working in US, they are from India. And hence these member of parliament and other think tanks, thinkers, they have advocated and they have convinced Mr. US President. And since last 3-4 days, I am reading that on WhatsApp channel, Mr. US President is now in favor of India since last 3 days. Because he is now convinced if this thing goes on, then these professionals will be, these Indians will be attracted toward China, toward Russia, toward other countries, and in that US will be alone. And this Mr. Wilson have been now convinced. And now he is giving some favorable response to Indians. And he is now permitting these US universities to admit the students from other countries. This is last 3 days development, which I am reading on WhatsApp news and other these news platforms. Means here these new initiatives will be there. Means we have to update that in, we have to provide our pedagogical skills, we have to provide our this medium of instruction, medium of this theory and practicals, and medium of, we have to update our curriculum so that we can provide that. Means just like in medical field or in this specialized field, we have to provide that so that our skilled persons are available. This training will help bridge the gap between data science and healthcare, empowering future leaders. Because I'm telling you now, multi-skilling is required. Survival of fittest is now going on. Hence, every now is to the graduates, those who are learning, those who are in third and final year of graduation, they are now also becoming awakened, and they are thinking, they are asking the institutes, you provide us that input so that we are employable. They don't want only degree certificates. They are least worried about degree. They are worried about this skill. They are telling these institutes, they are telling you, we want to pay that money. You just provide us these skills. Hence, this is new emerging, it will be there. New opportunity, it will be emerging in this means big data in healthcare also. These are different AI tools in healthcare. And in this Cura AI, it is in Indian based of startup. So these are top 10 nations in AI in big data analytics. This US is at the top, which I was telling you. Then UAE is also there. Means these are using these IoT applications or Internet of Things. Internet of medical things. Now it is new concept is emerging. Internet of medical things means using IoT applications in medical profession. This is global AI distribution. When this is these countries break up in that, USA is 29.1% market share. These are different. Yes, from my side it is okay now. Any questions? Welcome.
Thank you, sir. Participants, if you are having any questions, you can ask sir now. Or you can type in chat box.
But in case they are means time is since I have consumed 30 minutes more. No problem in that. In case they are having any questions or query or suggestion, my mobile email is with you, and you will be sharing with these 20 slides I have sent you for participants. In that, my email and mobile is there. In case they are having some doubt, some suggestion, or some more additional information, you welcome in that. No problem in that. I will provide them.
Thank you, sir. Actually, it was a very interesting and as well as elaborative session. Apart from this, at this age, after retirement also, it is very appreciable on your involvement efforts in such things that's participating in FDPs, n number of conferences. We looked upon your profile. Actually, this is very motivation factor for us, sir. After retirement
No,
also.
I'm telling you, I have been retired since last 3 years. My age is 64 years now.
Yes,
And
sir.
I am keeping myself active. And this
Yeah,
active, this dynamism.
It motivates us a lot. As a young professional,
what?
we are being motivated on seeing your profile and on looking upon your presentation, sir.
Madam,
It shows your efforts.
No, what I'm telling you, this initiative is from my first date of joining the academic. Since 1992, I have joined. The same speed I am continuing today also.
Consistent.
I am keeping myself engaged, myself in busy in these activities so that I can learn, I can protect myself also from these new concepts.
Interesting.
Because these data was not, these areas were not in our studies during our working.
Yes.
But now these new concepts are coming because of this new
Yes, that's what because what you covered is that is a technological the session that is oriented much towards updated technological advancement. You handled that session very well. You are keeping yourself updated. Very
yes, Madam, I am telling you in some of these, the latest data is of yesterday, which has happened in different venues, different platforms. And I have added these in these slides.
Sir, your involvement on keeping all this information in your slides is something amazing. Even though we are young, we wish you a very good, healthy, long life and continued professional growth, sir.
Yes, I should thank. First, I am thanking you for inviting me for this session, and plus thanking for best wishes for my health and wealth. Thanks for this. And I am of that opinion that we teachers, we should share our knowledge.
Yes, sir. Your contribution is needed for this academy as well.
Yes.
Thank you. Thanks a lot for your support.
Yes. Please, thank you. Yes. Should I leave?
Just a second, sir. Pushpa, madam.
Yes, or if any suggestions are there, are welcome. In case anybody is having some doubt or any clarifications, we should ask the participant in case they are having some.
Participant, if you are having any doubts or need clarification, you can ask, sir, or you can send a mail to the displayed mail ID in the slide. Keep note on that.
Yes, it is on the first slide. I am showing that. Even you are sharing that slides, the 20 slides I have given you. You can share that with participants.
Yeah, sure, sir. We will share.
Yes, please. Thank you. Yes. Okay.
Madam. Thank you. Okay, thank you, sir. We can conclude now.
Yes. Please,
Thanks
please.
for your
Yes, okay. Thank
Thank
you.
Thank you. Participants, please fill up the feedback form. We have posted in the chat box. After submitting the feedback, you can leave. Thank you, sir. Thank you, participants. Madam?
Ma'am, you can conclude, ma'am.
Okay. Thank you.
Susita ma'am, you
Okay. Thank you, participants, for your enthusiastic participations for the past 4 days. We are having 2 more days, that expecting your cooperation for those sessions also. Thank you for the assignments. We appreciate you all who have submitted your assignments on the given topics. Submit the feedbacks also. Be present throughout the sessions, because attendance are being monitored randomly. Okay, your certificate will be issued based upon your attendance percentage, not upon the feedback. So be sure that you are attending all the sessions without missing or quitting any session. Okay, see you all tomorrow. Thank you and good night. Thank you, madam.